Recording in progress.
Well, it looks like we've steadied out at about 240 participants, so this is a well-attended board meeting. Okay, so good evening, everybody. It is Monday, February 14th. Happy Valentine's Day. I'm now calling to order the regular board meeting for the Boulder County Board of Health at 5:31. And can I ask the board members to introduce themselves? I am Greg Thomas, Board President.
Morgan McMillan, Board Vice President.
Landry Fagan. Sorry.
Go ahead.
Landry Fagan, board member.
Brooke Harrison, board member.
Lindy Hinman, board member.
Okay, so we do have a quorum. And let's see. Camille, I'm not sure what you want to do about staff introductions. I would say, can you just introduce the folks who will be presenting in some fashion tonight?
Can do that, President Thomas. Hello, everyone. My name is Camille Rodriguez. I'm the Executive Director of Boulder County Public Health. Presenters this evening on any of the topics on our agenda include Deputy Director Dr. Lexi Nolan, Attorney Trina Ruland. We also have a presentation from Family Health Division Director Daphne McCabe, and I believe her staff, Natasha Stewart. And then later in the evening, we have some staff from our Environmental Health Division, including Mr. Bill Hayes and possibly Mr. Chris Campbell. Do forgive President Thomas and the board if I've forgotten any of the staff that will be presenting. They can also introduce themselves when it is their turn if I have left them out of that small introduction. Thank you so much.
Okay, thank you. And so we do have a quorum present, which is at least 3 board members. So this regular board meeting of the Boulder County Board of Health has been called to order at the discretion of Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference Zoom number, conference ID, so the public could participate. Obviously, we still have the COVID-19 pandemic ongoing and the need for social distancing to comply with the public health order. That's why this meeting is being held telephonically. Okay, so before we get into the agenda, I just want to make a few announcements. If you've been a past participant on the board meetings, you know that we've had public comment at the beginning, and that has included public comment on the COVID-19 pandemic, which is technically an agenda item. So we are not going to take public comment yet on anything related to the public health orders, COVID-19, mask, etc. Okay, so if there's anybody who has public comment about something not on the agenda, I'm happy to entertain that right now, and then I'll explain the process for the rest of the evening.
And please raise your hand if you do have a comment on an unscheduled item.
Nothing there?
Don't see anything.
Okay, that's what I figured. Oh, okay, so then what's going to happen is we are just going to approve the minutes from the last Board of Health meeting in January. And then we're going to go into, we're actually going to push item 3 on the agenda until after the public health order discussions, votes, and public comment. So what will happen is staff will present their their updates and their recommendations. Then we will take public comment, and then we will probably take a short break and then do the board deliberations. Okay, so the public will have an opportunity to provide comment before the board deliberates, and yet it will be after the staff proposes, provides us their recommendations. So hopefully that will, fine tune, further guide any comments that we have from the public. Per the bylaws and, per the bylaws and the discretion of the president, I am actually going to limit public comment to 90 minutes tonight. I think, we've had a lot of public comment over the last few months, and I do think that having the staff present first will provide some very useful information that may, lessen the need for extensive comment. And then when we do go into public comment, if somebody else has made a similar comment that you are planning to make, you feel free to kind of just say, I second, or I agree with, the comments, so-and-so. And so then that way we can get through as many people as possible in 90 minutes. But so I think that will be a better flow of the meeting, and it will be helpful to have that information present before you make comment. And so with that.
And Greg, I apologize for interrupting. It does appear we have 2 hands raised with respect to unscheduled items.
Okay.
Roxanne Solomon and Ryan Scott. Roxanne, can you just confirm that your comment is related to something other than masks and COVID?
Yeah, I just wanted to see if he could repeat what the agenda thing was, because I didn't really understand when the comments were happening.
So after we approve the minutes from the last meeting, I will take probably a minute. Then we will go into the staff presentations. I don't know how long that will take. Let's say that takes 60 minutes because there will be action items for the board. We will be voting tonight. And then after the staff presentations, if there's any clarifying questions from the board members, we'll do that. But then we will go into public comment. We will not do any board deliberations until after the public comment period is completed. And then the remaining agenda items are kind of more of our just informational and director's report type of things.
Great, thanks. And then Ryan Scott. Ryan Scott.
Hi, this is Ryan. I was just going to ask why these are still being held remotely. These meetings.
And so this public comment period, it's not a Q&A, it more so is just an opportunity to provide a comment.
If I could get my 3 minutes later, that would be great.
Yeah, absolutely.
Thank you.
We'll have an opportunity for public comment later. Thanks. Okay, Greg, that should do it.
Okay, so item 2 on the agenda is approval of the regular meeting minutes from January.
I move to approve the January 10th, 22 regular meeting minutes.
I second.
All in favor?
Aye.
Aye.
Okay, staff, Camille, I'm assuming you want to take it away and kick it off?
Thank you, President Thomas and members of the Board of Health. Yes, I am going to kick it off. If staff do want to put the PowerPoint up, that is also fine. I'm going to sort of introduce and set the table for the board and the public, the presentation that staff has put together for us tonight. As you know, the Omicron variant impact has lightened significantly in Colorado over the last few weeks. Many of our neighboring counties have decided to remove masking in indoor public spaces, schools, and even for the youngest in our community at daycares. Boulder County Public Health staff are also relieved to see the decline in cases, and we have been working over the past several weeks to track whether the positive projections were coming to fruition, to assess the bigger picture of where we are in this pandemic, and to consult with our community partners about their needs and the impact of potential changes, and built out a transition plan for shifting public health orders that will create a smooth transition for everyone in our community. Our proposals for the board tonight were not easy recommendations to arrive at, although we are optimistic about our ability to reach moderate transmission in our community soon, even though we are not there yet. Feedback from almost every sector in Boulder County we consulted, including the general public, was mixed, with some expressing a strong desire to drop the mandates and others expressing significant anxiety about a shift, possibly before the entire community is ready. Our goals at Boulder County Public Health remain the same: to prevent severe illness and deaths, to support the healthcare system, and to safely return to normal. At the same time, we recognize that change in neighboring counties itself creates new stresses for our community, including competitive disadvantages for many of our businesses and frustrations for some parents. We are in a very difficult position than we have been previously. The vast majority of our county residents has had at least one vaccine, signaling an intention to be fully vaccinated. Our latest variant confers less severe disease and death than previous strains, and people have much easier access to high-quality masks and at-home tests, and have become accustomed to using them. And effective therapeutics have been approved for all ages, from infants and on up. These are all tools that allow individuals in our community to protect themselves better, to manage their risk tolerance, and be less reliant on the actions of others. These are also the tools that will allow us to better meet competing needs, whether it is mental health, socialization opportunities, business traffic, or just establishing our normal rhythms in life. Our Boulder County community is in a strong position to take this next step towards normalization, moving from harm prevention to harm reduction. It's easy to see those steps along the way as the end, or at least as giant leaps. But it is also critical for us to remember that we must have a long-term vision and strategy for exiting this pandemic so that our safe return to normal is long-lasting and not part of a constant cycling of policy changes for our community. We also ask that the public and our partners recognize that these are steps on a journey and that we are likely to see some bumps as we adjust in the coming weeks. We ask for everyone's patience through that, acknowledging that COVID will be with us in some way for the foreseeable future. The decisions presented to the board tonight are big decisions for our community, but they are also a part of a longer-term strategy, a part of a broader ecosystem of decisions being made in nearby counties, by the state, and by the federal government. With that said, we would like to present information that explains to the board and to the public the considerations behind our recommendations and how this pivot fits into our larger strategy, as well as next steps that what we would expect to see if the recommendations were adopted. Excuse me. We hope this information is useful in helping individuals and families protect themselves according to their own circumstances and risk tolerance, while also helping our community join together and support each other through this transition. So now, President Thomas and members of the board, I am going to turn it over to Dr. Lexi Nolan, who has a COVID update for your consideration. Dr. Nolan?
Thank you. I'd like to confirm that everyone can see the slide that says COVID update on it. Is that correct?
Yes.
Thank you. Good evening, everyone. We will start with a surveillance update. It will be very short this evening because we do want to focus the majority of our time on really zoning in on what we have taken into consideration in providing recommendations to the Board of Health about potential shifts to our public health orders. We are very happy to see that the decline in cases related to Omicron continues. It is slowing somewhat, but it is still a precipitous decline. Our cumulative 7-day case rate is 273 per 100,000, which is lower than our 390 per 100,000 last week. We are still in high transmission. Our 7-day positivity rate is now at 10%, which is lower than last week's 13%. Our health system capacity is still a bit taxed. Our hospitalizations are decreasing, but we do still have some tight staffing issues, limited ICU and medical surgical bed availability, and about 11% of our beds are currently occupied by COVID-19 patients. And we do still have, we have 30 pediatric COVID hospitalizations last week, which is down from the previous week slightly. We have had 95 deaths since the beginning of May 2021, 352 deaths total since the beginning of the pandemic. You will notice that Omicron has renewed a little bit of a surge in deaths over the past few weeks. We do expect this to continue because we know that, of course, hospitalizations and deaths are a lagging indicator. They occur after cases have declined or have been incurred in the community. So we don't expect the deaths to immediately be falling with the COVID rates, case rates. We are happy that we have now reached 70% of our total population has had a full course of the vaccine, and 92% of our total population has received at least one COVID-19 vaccine dose. That is a wonderful reassurance to our community that we do have significant protection in our community. And with that, we will turn over to the discussion on COVID policy. And just to set the stage, we just want to remind the Board of Health and the public that we do have a strategy, a high-level strategy that we are using to develop our thinking about where we are in this pandemic and how we are able to respond successfully as a community together for the long term. It's really important in this strategy that we always support the community to create their own protective habits and practices, as that becomes the bedrock for longer term response as we are able to move away from public health orders. To do that, we have to keep a focus on the higher level strategy and the plan for the long term. We have to recognize when we are at inflection points in the pandemic, and we do believe that we are at an inflection point now. And we need to be intentional and not reactionary in responding to data, to our public health responsibilities, and to community needs. Trina Ruland will provide situational awareness of some of the policy shifts happening around us, as well as current expert recommendations.
Thank you, Lexi. I'm going to run through several slides, starting with what the CDC and the American Academy of Pediatrics recommend currently, and moving towards federal and state as well as local policy changes. The CDC's recommendations have not changed, and we do not yet know if or when they will change. They still recommend masks for all individuals age 2 and older in public indoor spaces during substantial and high transmission, regardless of vaccination status. For schools, the CDC recommends indoor masking for all students, staff, and visitors 2 and older, also regardless of vaccination status and regardless of transmission levels. The American Academy of Pediatrics has endorsed both of these recommendations. The American Academy of Pediatrics, as well as the CDC, are constantly evaluating data, although the American Academy of Pediatrics has indicated that their recommendation is through June 30th, 2022. Next slide. We have seen a pretty rapid change and shift in policies across the nation. This slide shows changes in policy among states that are statewide policies. It does not cover requirements enacted at a school district level or a local level across our nation. The big picture here is that states with mask mandates, for the most part, are putting an end date to those mandates, although the actual end date seems to vary by state. There are more states with school requirements for masks than with general or universal mask requirements. And generally, states are releasing their universal mask orders prior to releasing school orders. There are several states that are still in an evaluation process for releasing their statewide school mask order. Next slide. In Colorado, we are also seeing a shift. Several local public health agencies, of course, including ours, implemented universal indoor mask orders or school mask orders or both in response to the Delta or Omicron wave. LPHAs have, for the most part, either released or set a date on which they plan to release their mask orders. I'll bring your attention to Denver here, because Denver has seemed to follow the nationwide trend of releasing the universal indoor mask order first, later followed by a release of the school mask order. And their planned release is on February 25th. I will note that there are some school districts around the state that have implemented their own masking requirements, even though their county has stepped down their masking requirements. Next slide. The next two slides I'm going to talk about are the requirements that will remain in place at a state and federal level, regardless of any decision this board decides to make today. In the state of Colorado, there are two public health orders that will affect the general population. First, masks will remain required for unvaccinated individuals age 11 and older in jails, prisons, community corrections, homeless shelters, emergency medical, and other healthcare services. The public transportation is a reference to the federal requirements that are still in effect, which is mirrored in Colorado's order. So regardless of the actions this board takes in emergency medical and other healthcare services, and that includes places like doctors' offices, hospitals, clinics, masks remain required for unvaccinated individuals. The state has also taken over regulation of long-term care facilities. And that is a very detailed order with detailed mitigation requirements that I won't get into here, other than to say the state has that well under control. There is no expiration date set for the long-term care facility order. The mask requirement for the unvaccinated individuals in those specific settings has been renewed every 30 days, approximately 12 times so far. It is up for renewal or for not renewal on March 1st. We don't yet know what the state will do. Next slide. At the federal level, there are several requirements that will affect us here in Boulder County and continue to affect us. First, masks are still required in Head Start programs for all individuals age 2 and older. We do have several of those programs here in Boulder County. Those are early childhood education centers. Masks are still required by federal law on school buses for all individuals age 2 and older. I do not know, or rather we're not yet aware of what the end date is for either of those two requirements. Masks are also still required by the CDC on all public conveyances. That includes ride shares and public buses. And we do not yet have an end date for that order. The Transportation Security Administration has provided at least a renewal date for their order for airplanes and airports, and that is March 18th, 2022. Next slide. Before I turn this back over to Lexi, I just want to highlight the work that Boulder County Public Staff has done prior to bringing this to the board and the extensive consultation process that has gone in here. We have talked extensively with Boulder County municipal government leaders and other public sector leaders. We've worked with our business community to get feedback and elicit feedback from them. We've talked to our schools, and that includes both our major school districts as well as private schools, early childhood education providers, and other youth-serving organizations. We've spoken with our health system partners, including all of our major hospitals. We've worked with CDPHE and our neighboring local public health agencies. And of course, we've gathered a massive amount of public comments, all of which have been forwarded to the board.
Thank you, Trina. So there are a number of elements related to data science and facts that we have tried to take into consideration in developing these recommendations. And many of them are supportive of a transition to unmasking. And we also have noticed a number of cautions, often related to those same issues. We know, for instance, that cases have peaked and are declining. At the same time, cases are above our May 2021 levels, and we are still in high transmission. Our deaths are not yet falling, and future surges are likely. We know that 70% of our residents are up to date on their vaccines, but we also know that racial and ethnic inequities persist, that 60% of our 5 to 11-year-olds have had 1 or more doses, and that our 0 to 4-year-olds are not yet eligible for vaccines. Health system strain is lessening, but it is still strained. Treatments have been developed for all ages, but there will be several months before there is a significant and reliable supply of doses. We do know that Omicron produces less severe disease, and at the same time, there is emerging science on the long-term impacts. We also know that children experience less severe disease, and yet we have 30 pediatric hospitalizations in our region last week, and the science on long COVID is still evolving. Other factors relevant to policy decisions that we have worked to take into account is the recognition that surrounding counties have lifted masking, and that creates new pressures for businesses and schools. At the same time, expert bodies in some states have chosen to have recommended against lifting masking orders, especially for the youngest. We know that high quality masks and at-home tests are more widely available, but not everyone has obtained them. And our vaccination verification program has been in operation for 5 months with around 325 businesses signed up. And we also know that some businesses are likely to drop that policy as other policies change. So just to really take a look at, we wanted to do a little bit of a deeper dive on the issue of case metrics as a predictor of severe illness. We had proposed in the indoor public masking public health order that 50 per 100,000 or moderate transmission be used as a marker for when it would be appropriate to step out of requirements for masking. And when we looked at the data and particularly looked at cases shown in this top graph, mapped against hospitalizations shown in the lower graph, what we saw is that the peaks of the relationship between cases and hospitalizations in the Delta wave were not necessarily repeated in Omicron. And so what you see is that cases in Omicron surged significantly higher than the height of the Delta peak, and yet hospitalizations were lower during Omicron than the Delta peaks. And we think that some of the contributions to these differences include the disease severity of Omicron is different, the reduced viral load transmission due to vaccinations and masking, and the availability of therapeutics in the community. So with all of these kind of balancing questions, we had to reflect very carefully about what is really happening right now. Where does the weight of the evidence lie? What is the weight of the most important considerations? And we really started to feel like that we're in an inflection point in addressing this pandemic. Why is it an inflection point? Because the projections are very positive right now, and they seem to be coming to fruition, that our case metrics what we're trying to pay attention to in terms of the most important metrics is shifting. That vaccines are available widely for almost everyone, including that we have reached 80% community immunity as estimated by the state health department, and 92% of our own county population has had more than one vaccine. That there are resources for individuals to better protect themselves now. There are lots of tools that are useful in daily life for individuals, and it makes them less reliable on everyone reliant on everyone else. That effective treatments have been approved, and that being out of alignment with our neighboring counties creates significant burdens that are becoming more difficult to sustain. We do still have a couple of concerns. One is related to the healthcare system. We know that the healthcare system is still under a tremendous amount of pressure, and there is interest among our health system partners to continue requiring masking in these settings. There are some protections in place for unvaccinated persons to continue masking, as Trina mentioned earlier. And we also expect that most of our hospitals, if not all of our healthcare providers, will continue to expect masking in their environments. The other group that we are particularly concerned about is our early childhood education providers. We know that there is significant staffing stress in this sector, and this is a sector that's critical to supporting working parents in our community. We also know now, with recent information, that vaccines will not be available for this group until later this spring at the earliest. We are not expecting any updated state guidance for ECE, and the state and CDC strongly recommend masking be kept in place until vaccinations are available for the age group. So the conclusion that we reached is that we're cautiously optimistic about conditions and continued improvements, that the remaining needed changes are just weeks away, not indefinite, that the community has demonstrated a strong response in terms of protective habits and practices, that competing needs are increasingly important and must be balanced, and that strong recommendations to continue masking, especially for vulnerable members of the community, are important. Now, what this inflection point would mean is that we would be shifting our approach. We would be shifting from emergency crisis approaches to really thinking of COVID in terms of a regular infectious disease and infection control measures that are applied to other diseases that public health regularly oversees. That we would be shifting from risk avoidance and harm prevention to risk management and harm reduction. That we would be shifting from a universal protection of the population to really much more targeted protection of the vulnerable. That we'd shift from orders to strong recommendations, and from masks and quarantine and isolation guidelines to an encouragement to use various mitigation layers and requirements that are in line with regular public health disease management protocols. So based on what we have presented, we have the following recommendations for the Board of Health to guide us going forward. The first would be a vote this evening that would rescind Public Health Order 2021-08 on public indoor masking on February 18th, indicating that masks would no longer be required by BCPH in public indoor spaces. That, second, that we amend Public Health Order 2021-07 on masking in schools, ECE, and youth programs. That we would rescind required masking and quarantine and isolation guidelines for K through 12 settings and 5+ settings on February 25th. And that ECE and under 5 settings would maintain current requirements and consider changes at the next Board of Health meeting. Based on the decisions the board makes this evening, BCPH will likely issue an advisory for strong recommendations to to the public during substantial and high transmission, including for healthcare settings, ECE and under 5, and other groups. We also note that the other state and federal requirements that Trina mentioned earlier will continue as previously noted. And I recognize that this is the summary of proposals. I'm happy to take a pause and take clarifying questions from the Board of Health at this point, but we do have some additional information related to implementation that's important for consideration that we would like to present before your discussion and vote.
Lexi, can I ask a few clarifying questions going back to some of the presentation?
Indeed.
So for the ICU, it's 11% COVID-19 patients and 30 pediatric hospitalizations. In these numbers, are these entirely due to COVID, or are some of these incidental, or some of these patients who came in for other reasons and then happened to also test positive for COVID?
So in the measures of available hospital beds, that includes the totality of hospitalized patients. The specific relation of the proportion of COVID patients is reflected in that 11%, and that the information on pediatric hospitalizations is COVID specific.
Okay, thank you. And I have a couple of questions on the masking as well. So the Head Start programs, I'm just curious, the ones in Boulder County, are most of those entirely Head Start participants, or are many of those Head Start programs mixed? So it's a school where you might have 25% Head Start and the rest are not involved in the Head Start program.
Trina or Camille, do you have information on that?
That's an excellent question. I know that we have 3 Head Start locations. I do not know off the top of my head whether or not they are intermixed with others. I can
Okay.
find that out though.
Thank you. And then one last question on the masking. So for the ECEs, do we have any idea of if the masks are being worn properly? And also, are the ECEs, are most of the young children wearing cloth masks, or do they have pretty good access to well-fitting KN95 masks now? I ask because the majority of the concerns that we got leading up to this meeting have mostly been around daycares and early child care settings with complaints about quarantining, masking, and also questions around improperly worn masks at that age anyway.
Thank you for the question, Brooke. I don't know that we had specific data on what kinds of masks children are wearing in the percentage of time that they're masking correctly. I do know that in the ECE setting, masking of staff is also a particular concern in order to maintain continuity of the workforce in that setting, and that a number of ECE providers continue to work with families to ensure that children are safely protected.
Thank you. I'll let anybody else ask questions, and then I have some questions about the proposal.
Can I jump in? Sorry, I can't see everybody on my.
Morgan, you can go ahead.
Okay, thanks. So thanks always to the staff for putting these presentations together. It looks like we have at least a couple weeks worth of data from Eagle and Summit about dropping masks in schools. Do we know what their numbers have looked like in schools since they've dropped masks in schools?
I'll have to defer to the experts in epidemiology on that one. But one thing I can say is that Eagle and Summit counties have tended to be at the front end of the curve when we've had waves. So they've usually gone first in some policy making areas because of that. I know that doesn't completely answer the question, but at least it can get us started while we wait for someone else to come on.
Okay. Thank you. Another question about, you summarized what you have heard from local medical providers. Have the school districts asked their teachers and staff how they feel about dropping masks in schools? Do we have a sense for that?
I believe there is some significant support from teachers to maintain masking, but it is mixed when we talk with our school districts and various constituencies within those districts about whether it's the right time to begin to move out of masking.
I just wanted to add, Morgan, we did talk to our health staff, but they don't speak for all the teachers, but there is some positive sentiment with moving in this direction. But I don't know if Soda or anyone from the school team, Heather, would want to jump on and share, Salam, and share if they've heard anything specific to teachers.
I think similar to similar to what's been shared before, there's a lot of mixed perspectives around moving forward without masking. Some teachers and staff are feeling reticent and others are feeling like it's the right time.
And then I have I have so many questions about what protocols will happen, and I don't know if it's the right time right now or if it's during deliberations, but I mean, it does have to do with, coming from a 2-parent working household with 3 kids in school, like highest priority is keeping kids in school for me. So I'm just wondering how protocols would go going forward if there is a case in class, and is it test to stay, or what would happen to keep kids in schools?
Thank you. I think we're going to get a little bit into that conversation about the implementation a little bit more in the next section. I will mention that a number of school districts, as counties have moved out of county level mask mandates, have developed their own guidelines, and we would be very supportive if schools or school districts were interested in implementing their own masking requirements and supporting them to do that.
Okay. I think that's it.
Yeah, we don't have a lot of information from Eagle or Summit counties at this time, but we do hear from them anecdotally that they are continuing to see declines, and they haven't seen significant outbreaks after they lifted their mandate. We would expect that we might see, a little bump as we go forward if we were to adopt a rescission of the order for K through 12.
Okay, thank you. I think that's it for my clarifying questions anyway. Thank you.
Okay, we will do Greg, Lindy, and Brooke in this next order. Actually, Lindy, go ahead. I'm gonna have to ask my family to adjust something.
Okay, thanks, Greg. So similar questions. I just want to get a sense. I know we saw some data that shows that hospital systems capacity is still quite stretched. Can you give me a sense of how our provider partners have been reacting to this proposal?
Right, thank you for the question. Trina, would you like to provide detail from this article, and maybe Michelle on other conversations? I will say, go ahead.
Oh, I'm sorry. I didn't hear quite all of the question. I wanted to make sure I got all of that.
The question is, how are our health system partners responding to the proposal to stand down the masking order?
That's a hard question to answer again, because the sentiment that I heard loud and clear was we are going to continue requiring masks in our facilities, regardless of what you do. I think I'll defer to Michelle on the remainder of that response.
Yeah, hi, this is Michelle Huss. I mean, I wasn't able to get in touch with all of the of everyone I'd hoped to reach out to. In the few folks I was able to get feedback from, and this is also drawing on my own personal experience as a physician practicing at Denver Health. The hospitals will issue their own mandates for folks to wear masks in their facilities. And to be perfectly candid, having a public health order for masks in healthcare settings wouldn't necessarily change, or help or harm those approaches that each healthcare facility would take an individualized approach. That's what's happened at Denver Health in terms of our masking and recommendations. And again, I only was able to speak to a handful of people, so I can't really generalize, but that was that of the folks that I spoke to, that was the sentiment.
Okay, thank you, Michelle.
Lexi, earlier you presented 70% of residents had a full course of vaccine. I assume that does not include boosters.
That does include that 70% are, I believe that includes that 70% are up to date.
Okay, all right, good, thank you. And then do we know, I know at least during Delta, we had talked about, through contact investigation or case investigation, that a lot of the students in the K through 12 were experiencing their exposures outside of the school. And do we know, if during Omicron, I think we were not able to stay, just due to the overwhelming caseload, we couldn't do as many case investigations. So I'm wondering, with Omicron, is that still in ECE? Do we see the same kind of pattern where the exposures, any of the kids that test positive get, do they come from the ECE or do they come from outside of it?
I'm wondering if Elena might be able to speak to that issue.
Hi, yes, I'd be happy to. We certainly saw a significant shift in the source of transmission for our early care and educated associated cases during Omicron. While there were some household exposures, it seems like the vast majority of cases were actually being infected at childcare settings due to the rapid and relative ease of transmission under this variant of the virus.
Thank you. That's all the questions I have for now. Brooke?
Yes. So for the summary of the proposals for number 1, the asterisk about the healthcare settings, could you clarify that? Does that mean that we will maintain a public health order for healthcare settings, or does that mean that healthcare facilities will be responsible for developing their own potential masking policies?
I think at this point, we're expecting that it makes most sense for healthcare settings to develop their own policies. And if they need support from public health, that we're happy to provide that.
Got it. And then another question. So February 25th for rescinding the school masking mandate. I can't remember from the slide. Does that put us last in the state? I seem to remember that most of the counties all are prior to February 25th. Most of them did it concurrently with their universal mask mandate, except for Denver.
So just to be clear, that vote would be to amend the order to remove masking requirements for K through 12 and to hold it in place for ECE and under 5 settings. And that February 25th deadline or date is in alignment with Denver.
Got it. Okay. And then for the ECE settings, this might be something that you'll get into later, but I'm curious why we're opting to maintain our county public health order instead of referring to the state guidelines and the CDC guidelines to sort of allow the ECE settings to cite those as reasons for maintaining masking and quarantining.
So what we've heard from our partners is that it would be a significant burden for them to take over the masking requirements, that we as public health have particular concerns related to our role and our responsibilities for protecting the vulnerable, given that We know that vaccinations for that age group are significantly on the horizon and that this is a critical sector for our community to continue to recover. We also have concerns that if we don't maintain uniform masking across the county, that we're going to be presenting some more significant equity challenges in relation to differentials with Head Start programs. And so it's partly an effort to at least keep that sector in alignment as we protect that population until they can get vaccinated.
Okay, thank you.
And CDC recommendations are to hold masking in place for that group until vaccinations are available, as our state recommendations.
Okay, thank you everyone for those questions so far. Lexi, I assume there's additional presentation.
There's a little bit more that we would like to present to the board that provides some context about what this would look like going forward.
Okay, please do.
So what we would expect during a transition is that in terms of data, we may see that improvements may slow. This is assuming that the proposals that we have presented to the board were accepted. So improvements may slow. We may continue to see some high death rates for at least a few weeks, and we will continue to see seasonal or variant related surges, probably very likely in the fall and perhaps at other times also. In terms of public spaces, we may see some folks who are feeling anxious about being in school or in public spaces, and we do want to support them and ensure that people feel comfortable continuing to wear masks if it's appropriate for them. We may see some folks taking unnecessary risks in response to order changes. And we may see that business policies could be challenged. Even for businesses who have really benefited by having their own vaccination or masking policies in place. In terms of schools, we may see a few more increases in outbreaks until the cases settle out, but we don't expect that to continue. And we would expect to see some administrative burdens increase in the short term during policy transition. And if schools decided to develop their own guidelines and policies, and again, of course, during new surges. In preparation for indoor masking step down, we would really want the time between now and the 18th to communicate changes to businesses, our municipal partners, and the broader public. To distribute new signage for folks that would help them to communicate out, and to transition the vaccination verification program to a fully business-based program where businesses decide whether it's valuable for them to hold their policies in place and continue to require vaccinations or masking, and BCPH would cease tracking participants in that space. In preparation for a school masking step down, and this is specific to K through 12, we would want to support schools to develop and implement internal policies and guidelines for ongoing management of COVID so that they are beginning to take ownership of that work, to support parent communications on changes so that it helps support the schools in making a smooth transition and be clear about expectations, to ensure students feel free to exercise their option to mask and staff feel free to exercise their option to mask without being bullied and in accordance with the adopted guidelines. And in relation to ECE and under 5 activities, camps, and extracurriculars, we do want to immediately begin to look at opportunities to further relieve isolation and quarantine requirements to help keep those under 5 kiddos in class and keep staff at work. And we think we have some approaches to how we might be able to do that. And that would take place immediately. So in terms of the public, so we've talked about how a lot of this is really predicated on working with the community to support habits and protective measures. And in terms of what we hope to see, we would hope to see that businesses and schools have their own policies and guidelines going forward, that families and businesses have rapid tests and masks on hand, that people continue to mask in public spaces based on their risk tolerance and peace of mind, based on when they are symptomatic, when they've had a positive test or are recovering, especially during a substantial or high transmission. And we will have to continue to make sure that those metrics make sense in that context. But in terms of recommendations, we certainly feel like that is still a useful metric. We would also hope that people test using at-home tests based on either being symptomatic, or if they are preparing to visit a vulnerable family member or friends, that they are testing prior to that visitation to make sure that they aren't spreading the virus. And finally, to maintain up-to-date status on vaccines and to be responsive to new developments and challenges that may come through our community. So finally, as we think about our layered mitigation strategies, we know that we're letting go of a lot of those more burdensome strategies going forward for the most part, unless something unexpected significant were to come up. So those items that we're really moving away from are in red. There are some spaces where we're going to continue to work, like vaccinations and particularly vaccine equity. And there are some adjustments that we'll be making going forward in terms of when to test and what our case investigation and contact tracing work will look like specifically. And when people get sick, they not only isolate, they can also seek treatment. So in relation to what this means for our own agency, what we're really trying to do is move towards regular disease management processes. So eventually we expect there to be state guidelines that are related to the state communicable disease manual that might include things like reporting cases, investigating and containing outbreaks specifically, maintaining our local partnerships. And then in the shorter term, we expect that we would be pivoting to continue to focus our CICT work on outbreaks only. We will likely be stepping down mass testing and vaccination over the next couple of months. We will continue our vaccine equity work for a while. We are particularly interested in making sure that the racial and ethnic inequities that we are seeing in the 5 to 11 group and then are being addressed. We currently have only 22% of our Latinx population in the 5 to 11 age group have a vaccine, and we want to make sure that we are also providing an opportunity for parents of children 0 to 4 to have reliable information about the risks of vaccination and what kind of protection it confers. And that is in development, obviously, as the science continues to come in. That we will continue data collection, public reporting, and surveillance updates, but the tempo may change a little bit. And that we are also considering future scenarios that would require stronger public health action to manage COVID. And with that, I will happily turn this over to Camille to talk with you about the proposals on the table.
Thank you, Dr. Nolan. Thank you, Trina. Thank you for all the staff that jumped in to answer these very important questions. President Thomas, I would assume there's, you have an order that you wanted to also entertain public comment ahead of your deliberation. We have the slide up again that Dr. Nolan showed us previously of the recommendations we are making for your consideration. I'm putting towards you now, President Thomas, the opportunity to ask any other questions ahead of perhaps the next step, which would be the public comment piece ahead of your deliberation.
Just one last question. So we heard that, well, even if the county did not have a mandate for masks in healthcare settings, that the healthcare settings would likely have their own policy, right? And I think most people understand why healthcare, is kind of singled out that way. If it would be, so is my understanding that it's easier for the county to maintain the mask requirements in healthcare settings so that each healthcare setting doesn't have to create their own proposal? or their own policy, right?
The best way I can answer that, President Thomas, is in our discussions with our healthcare partners, many expressed a desire to maintain masking policies, whether it is through a public health order or in their own organizational policies, at least for the next 30 days as numbers continue to hopefully trend downward. But also because of the continued numbers of beds in usage. And
Okay.
I think that, of course, you're in a position as a board to direct us. It's your pleasure if you feel like supporting the hospital systems through the mechanism of a public health order would be helpful to them for a set period of time. But also it was loudly expressed that many of them would have those policies in place so that our public who does utilize any clinics or hospitals associated with said organizations with policies in place should expect that when they go to see their physician or nurse practitioner, they're going to have to mask up. So it's really a consideration for you. We put it out there because it was part of our partner outreach, and it was their expression to us that it was an important piece. One way or the other, I think the public should expect that in most of those types of facilities, they will need to mask up.
Thank you for that clarification. That makes sense. Can I ask, how far down the line does healthcare, the definition of healthcare, go? Are we talking chiropractors, massage? I mean, I would assume hospitals and clinics and doctors' offices, obviously, but further down the line, I'm just curious.
If Boulder County Public Health were to order healthcare facilities, it would include smaller clinics like a chiropractor's office, a local small business as such. I could have Ms. Ruland expound on that if she feels that I'm missing any pieces of that puzzle, but it would include small and large hospital and healthcare systems and clinics.
So if you wanted to go with an order, my recommendation would be to align with the CDPHE order that requires unvaccinated individuals to mask. And the language that the state uses is emergency medical and other healthcare settings, including hospitals, ambulatory surgical centers, urgent care centers, clinics, doctor's offices, and non-urgent care medical structures.
Okay, thank you. We can think about that. Brooke.
I had a question on the feasibility for the school masking order, the 07 order. Would it be possible in deliberations to request that order be split into two to separate the K through 12 and the ECE settings into two different?
Yes, it is both possible, and that is the recommendation of staff.
Okay, so we would vote then K through 12 and then vote on ECE separately. And then I just also had a question. So ECE, many of those, especially in Boulder, are private. They would still be beholden to any of the masking and quarantining requirements if we maintain the public health order, correct?
Correct.
Correct.
That's it. Oh, and one other clarification on item number 3. So the advisory, that would be a blanket advisory, just that you should mask if you're 2+ years of age and we are in substantial or high transmission, correct?
That document would be strong recommendations advising the community of the steps by which they could protect themselves and others from transmission of this virus. It would be inclusive of the of the items that are currently in our orders, but it would turn into an advisory to continue with the values that we've been working to impart to the community to protect and promote health during this pandemic.
Got it. So it would not just be the blanket advisory for individuals to mask. It would also include masking in schools and ECEs under that advisory.
If the board, if it's the pleasure of the board, for example, to stand down Public Health Order 2021-07, which is the school order in its entirety, for example, then we would incorporate advisements within this advisory that in turn have the language that was in the order, but turn it into a recommendation. So in other words, in order to continue with the layered mitigation strategies and the advisements even to continue to get vaccinated and boosted for those in our community who have not done so, it's helpful to us as we will continue to survey this pandemic, to gather data and provide updates to our partners and to you, and keeping the advisory alive with language that mirrors what we used to require, for example, should you go that route, and now advises it for a period of time until we can see a continued trend of downturn cases was our intention in this space.
Got it. And the other counties that have removed their school masking mandates, have they issued a similar advisory?
In the collaborations I've had with partners around us, I do not believe they have. They've put out significant pieces of information on their websites, encouraging vaccinations, for example, and to support the vulnerable by masking around those that are immunocompromised, et cetera. But I do not have information to support my knowledge that they issued an advisory. No.
Okay, thank you.
All right, Morgan and then Landry, and then we're going to move to public comment period.
Hey, thanks. Just keep mine short. Just a point of clarification. So in classrooms that have a mix of pre-K and K, would you continue masking if it includes kids who are under that kindergarten? I think there's a couple, at least, schools that have mixed populations. Would you?
That's an excellent question. I would have to say that if it's a mixed classroom, it would be more than likely that we would request that all students in the classroom mask if there are children under the age of 5 in that classroom, mixed with children 5 and over. Thank you for that question. That's a good consideration.
Thank you. Follow-up question to my question about whether or not we've heard from teachers. Have the school districts weighed in on this proposal just from a leadership administrative level? Are they prepared for this and they are in support of it?
I've been connecting regularly with the leadership, with administration, and they've over and over expressed their support, either for continuation of orders or to be at the ready for stand down to communicate with parents and guardians and staff of schools as to what the next steps might be. As you can imagine, and as Dr. Nolan alluded, there will be discussions that must be had with school health personnel, as well as leadership relative to the changes that will exist without the order in place. Boulder County did make a strategic decision to incorporate its school guidance into its public health order 2021-07. And so therefore, once the order goes away, so does the required guidance. And we will be, should that be the pleasure of the board, working with the school, all schools, to understand what the next steps are for the guidance that they will have to ensure occurs and is effectuated.
And then thank you. My last just, I guess, point of clarity here is that the delay between today being the 14th and having a public health order expire on the 18th and then the 25th is to support communication and outreach around the details of doing this, just so that that is clear to the board and clear to anybody who might be waiting to talk also, that that is the reason why you're recommending a delay between today.
Yes, ma'am. That's the recommendation. That is the basis for that recommendation. The importance of providing our community, especially our business partners, with new signage and clarification on next steps. It takes an incredible amount of time to do those communications and get them exactly right. And we're here to support our community. And that is why we've recommended the delay. It is obviously at the pleasure of the board. What you decide, we will also support.
Thank you.
And Landry.
So I just had a quick clarification. If we were to continue masking in EC settings, well, or if we stuck with just the advisory, could individual private ECE settings make their own determination about maintaining masks? It wouldn't be.
Yes, doctor. It would be, so should it be the pleasure of the board to not continue Public Health Order 2021-07 in either setting in K through 12 or ECEs? It would be up to K through 12 or ECEs to make their own policies. The public health department would not be involved in enforcement, et cetera. It would be really in each entity could implement their own employment policies, participation membership policies, et cetera.
Thank you.
Okay, so it is now 6:42. We are going to enter public comment period. I think we have a list of who signed up in chronological order. Is that correct, Kate?
It's actually randomized.
Oh, it's randomized. Okay. All right. That's good. And we do have 73 people signed up. You don't all have to give comment at this point if you don't want to, or feel free to, just keep it short and sweet. That way we can get through as many people as possible. So with that, let's see, was there anything else I wanted to, no, I think that's it. So let's go ahead and get started, and we'll close public comment at 8:15 p.m.
Awesome. Thanks, Greg. And for everyone's reminder, speakers will have up to 3 minutes. But as President Thomas mentioned, we do have more than 30 speakers signed up to speak and a 90-minute cutoff. So feel free to, second prior comments or keep your comments short, but each speaker called will have up to 3 minutes. So we're going to start with Sarah Ann Miller, and Ann Green is on deck. As I call you, please use the raise hand function so that we know you are available and we can go ahead and unmute you. So we'll definitely need you to use that function. Sarah Ann Miller and then Ann Green, you are on deck. And Rita, I do see, I thought I saw Sarah Ann with her, I see a Sarah Ann with her hand raised.
Hey guys, my name is Sarah Ann Miller. I am a parent of 3 kiddos in the St. Vrain Valley School District. My daughter Charlie actually wanted to share, but had dance, so instead she wrote in her heart. She has had the opportunity, thanks to our school district, to have an exemption, which has been a huge blessing for her, as well as our other 2 kiddos after last year's extremities, if you will. However, what she has started to share with me is what's happening at school and the things that are heavy on her heart with her friends and also with the teachers, and how worn down everyone seems to be and the morale as a whole. And she continues to ask me, Mom, what's it going to take? And so as a parent, I think a lot of us, we've followed the science, we've done our part. We've listened to you guys as the experts and your advice to us in hopes that, as you advise us, we can trust you and the things that you have put in place. But we firmly believe, hearing from our students and hearing from my daughter alone, that it's time for us to give choice to the parents and choice to the students and also the faculty and staff. There's a lot of disruption within the classroom. And I think that this is one thing that we can all agree on. There's opportunity for us to have a choice here. And we're hoping that tonight you will allow that for each student, each family, each teacher, so that we can continue to see those smiles and hug one another again and hopefully move into a different phase. So thanks for having me. And thanks for all you guys do for our students and community.
Great, thank you. Anne Green, I see your hand. Your 3 minutes will start now. And Rebecca Fato, you are on deck.
Yeah, hi, thank you for the opportunity to speak. I just wanted to point out that healthy children's risk of disability or death from COVID-19 is essentially zero. So ordering mask wearing for all of Boulder County and also by extension, as the previous caller mentioned, students in the St. Vrain Valley District schools in Weld County is not based on science. There have only been 2 randomized studies on the effectiveness of masks to prevent COVID, and both showed that masks made no difference whatsoever in preventing transmission. There's also no data indicating that asymptomatic children are spreading the virus to adults in school and childcare settings. In addition to not preventing the spread of COVID, masking children causes real harm. Speech delays in babies and toddlers are increasing, and referrals to speech therapists have increased almost 4-fold since before mask mandates went into effect. Research out of Brown University indicates a 23% drop in scores measuring children's IQ since the start of the pandemic. Research indicates that just minutes of mask wearing leads to dangerously high carbon dioxide levels in children's bloodstreams. This oxygen deprivation in the long term could very well be what's causing the reductions in intelligence that I just mentioned. The Head Start programs that you think are so important to equity are likely doing more harm than good when you keep the kids in the programs oxygen deprived. So no matter how well-intentioned your policy is, it's likely doing more harm than good. So a cost-benefit analysis informs us that healthy children should not be masked ever. In an interview with Colorado Public Radio in December, Governor Polis said the emergency is over. Public health officials don't get to tell people what to wear. That's just not their job. I couldn't agree more. It's time to stop ignoring the emotional, social, and developmental costs of widespread masking. No one elected you to make personal health decisions for us, our families, our local businesses, or our schools. School superintendents are hiding behind your orders to continue forcing students to spend upwards of 7 hours a day covering their faces at school and on the school buses to and from school. It is past time for you to stop abusing your positions by imposing masking, particularly on our most vulnerable. You all should be held accountable for the harm you've already caused. And also the fact that you're still holding your meetings remotely is ridiculous. If you honestly thought that asymptomatic cases spread COVID and that masks and vaccines work to stop the spread, you would be meeting in person with masks, not making excuses. Thank you.
Great, thank you. Rebecca, your 3 minutes will start now. And Eric Mondro, if you can raise your hand, you're on deck. Rebecca, I saw your hand and then we lost you. Are you still on? Okay, we'll move on to Eric, and then Rebecca, please raise your hand if you come back on and we can come back to you. Eric, your 3 minutes will start now, and Layla Young, if you can raise your hand, you're on deck.
All right, thanks. So I really like where this is going. I think that we're moving in the right direction here. I'm a resident and I'm a parent of high school and college students, and I'm also a primary care physician in the county. I think I'll just limit my comments to the healthcare system element of what you were talking about. I think that it would be most beneficial to address that with guidelines and recommendations, and I don't think that that mandates are necessary for that setting, because for the hospital systems and the urgent cares and the surgery centers, I think that they have the ability to make their policies responsibly. But then, I'm really more concerned with the small office buildings. Small office practices. That those are different and varied, and you can imagine how there could be a different circumstance for the need to have higher level of protections for, let's say, an oncology office where they're going to have at-risk patients who are immunocompromised, compared to a psychiatry office where it's much more important to have the personal interaction and not be hindered with masks. I can even see in a primary care setting where we have discussions about mental health issues or other reasons. So there may be some real importance to give flexibility to medical offices. And so I think guidelines would be sufficient, and requirements would be more harmful. Thank you.
Great, thank you. Anne Marie McDonald, you are on deck, and Layla Young, your 3 minutes starts now. Thank you. Layla, you can start now.
Hi, can you hear me?
We can, thank you.
Great, thank you. I have 2 children, and my younger son was born on the day Boulder shut down. He has never known a normal day in his short life. I'm making the case that masking kids and teachers does not offer benefits. It's detrimental, especially to groups of children who have been forgotten in pandemic policies. This is based on data as well as my experience with a child in daycare and speech therapy. Here's the data. In all of Colorado, no COVID deaths in children under 15. This includes counties without mask mandates. In Boulder County, despite high case rates, no COVID deaths of any children or teenagers. Data also shows that our youngest unvaccinated children are not at any higher risk of death from COVID than they normally are from the flu. In communication with the state health department, I learned that child hospitalizations have been very low in Boulder residents, low enough that they could not release the numbers to me due to confidentiality. In the interest of equity, has the board overlooked the detrimental effects of masking teachers on particular groups of children who need to see mouths moving? Typically developing toddlers, children in speech therapy, children learning to read, English language learners, autistic and deaf children? Full understanding of emotional cues and nonverbal communication requires the whole face. Well-controlled real-world studies have not demonstrated any clear benefit of masking students. Other studies, such as those in the CDC's MMWR, did not reach statistical significance or did not include well-matched unmasked control groups. Teachers say that clear masks are very uncomfortable and face shields are not allowed. No other accommodations are available besides spending significant time outside, which is difficult at winter. Data shows that vaccinations, not masking, will prevent severe outcomes in adults. Boulder's population is highly vaccinated. It's time to make masks optional for adults and children in all indoor locations, including schools, especially our youngest children who are desperately in need of normal interactions. Children's risks are too low to continue masking. Let's show them that we value their needs beyond simply not getting COVID. Their health and well-being depend on it. Thank you.
Great, thank you. Joseph Messling, please raise your hand. You're on deck. And Anne Marie McDonald, your 3 minutes starts now.
Hi, thank you for hearing my comments. I agree with pretty much what everybody said thus far, and it's very encouraging, as are the recommendations to move forward into the next phase. I am a parent with a child at CU and also at Boulder High. And I believe first and foremost in medical freedom and not force. I respect the recommendations of the Board of Health, but I don't believe that the authority is there to mandate, given where we are at this phase. We have to learn to live with COVID. And I believe that we have the right to bodily autonomy and should not be forced or coerced into wearing a mask. Not everyone can tolerate mask wearing medically nor emotionally. And those who wish to continue wearing masks indoors can do so. As good citizens, we know to wash our hands and stay home when we're sick. And in Boulder, in the state of Colorado, COVID numbers are down. We have high vaccination rates as well as high natural immunity. Omicron kind of went through the whole population, vax and unvaxxed. So some people have both natural immunity, vaccination immunity, and all of these things warrant lifting of the mask mandates. Let's follow Governor Polis's lead, as he finally came out and said, as well as Adams, Arapahoe, Denver counties, and others, and lift the mask mandates now in all indoor public settings, including our schools, and including, not excluding, our youngest children, which I agree with the comments of they're in most need of seeing the faces and their emotional, emotional health, the mental health issues. I mean, so important, and we can't wait to see all the down the line ramifications of these continued mandates, because they're not going to be good. Enough is enough. Scientific data published thus far does not support the effectiveness of masks. At best, the studies are inconclusive. Countries like the UK, Netherlands recently came out and lifted mask mandates, citing that the science doesn't show they have any statistical benefit in stopping the spread of a virus. It is spread through the air, aerosols, and the virus has been determined to be 0.06 to 0.14 microns in size. Even an N95 can't filter that out. So the time is now for us to learn to live with COVID. We can't outrun the virus, but learn to live with it, and not at the expense of our well-being nor the well-being of our children. The mental health ramifications of continued mask mandates will be catastrophic. We have already seen huge increases in anxiety, depression, and suicide rates. People are suffering, especially our children. Unmask our children now. The risks outweigh any potential benefit. Let them and all people breathe freely, interact with one another, as their development and all our mental health and well-being depend on it. And I agree with the other posters about these studies that are coming out. There was that Germany study that recently was published, 68% negative effects on children from mask wearing. Brown University study where the cognition was declined, I think somewhere around 23% in children 0 to 5 that they've been tracking since COVID started, like babies till 5. And they're seeing that. And the time is now. And there's no bullying. If people want to still wear their masks, then they can be free to do that. Let's respect every family's right to decide what's right for their family. Let's have medical choice. Thank you.
Great, thank you. Elizabeth Fashing, if you can please raise your hand you're on deck, and Joseph Messling, your 3 minutes starts now.
Thank you very much, Kate. Good evening, Boulder County Public Health. I do want to thank you very much. Lindy called me. We had a very constructive discussion, and I really appreciated it. I've really appreciated the team for the last couple of years, and a lot of the things we've all gone through together. My request is, when you end both orders tonight, you need to align all of it. There should not be, this is what's frustrated the public. There's a rule for this group. There's a rule for that group. There's a rule for another group. That's what's confusing to people. And it's making us distrust you as an organization. So just align the organization and then all of them. You don't need to wait another week. Just do it. And again, I really do appreciate you. And I will go on a little bit of a mask rant, which other people have done. The CDC has admitted the cloth does not work. I get it. I have said this for 2 years. A well-fitted KN95 mask, that works. And if that makes you comfortable, there is one-way masking also works. So do that. No school is going to deny a children or an employee the right to wear a well-fitted KN95 or higher mask to protect them if they feel that does so. And again, track your data. Twin Peaks Classical Academy, 25% mask exemption rate. Our data is in line with the rest of the county. Schools that claim they have 0, schools that claim they have 10, but our data aligns. And in fact, Twin Peaks Classical Academy has a lower case rate and data rate than the St. Vrain Valley School District as a whole. I can't compare it to Boulder Valley School District because they don't publish their data. And again, I really do appreciate you. Let's get rid of these masks. Let's give kids some normalcy. Children, two-year-olds should not be wearing masks. The WHO doesn't agree with that. Western Europe doesn't agree with that. We're in some weird world where we think they should be. And one more plea for Boulder County Public Health. You need to be meeting in person. Your staff needs to be at work. If you believe in vaccinations, if you believe in masking, if you believe in all of the mitigation stuff, you need to be at your jobs and be meeting in public. My staff, frontline, and God bless them, half of us have caught COVID and we're at work every day. You need to be setting the example. You need to be at work and leading the way and not hang. Thank you.
Your time is up. Thank you.
Thank you. Elizabeth Bashing, I do not see your hand. Please raise it if you join. Stephen Hennessy, can you please raise your hand? We will move on to you. Okay, great. And then if Katie O'Block can raise her hand, you'll be on deck. Stephen, your 3 minutes will start now.
Good evening. My name is Stephen Hennessy. I live in Boulder. Wearing a mask is one measure that helps prevent transmission of airborne illness, and our public health department should be educating people about disease prevention. But imposing government mandates that threaten criminal punishment is an extreme measure. The enforcement clause in Boulder County's mask mandates threaten penalties of up to 18 months of imprisonment in the county jail. In Casey v. People, the Colorado Supreme Court held that a public health department does not have the power to define a crime. That power belongs exclusively to our elected officials. Our public health department should be focused on educating people about how they can stay safe. I think when you guys wade into what is lawful, what is not, that runs a serious risk of degrading the public trust. And that can really undermine, I think, the core mission of what public health should be doing, which is, again, educating people about how they can equip themselves to make the decisions that are right for our community. I'm encouraged by the conversation we've had tonight, and I do believe that our public health department is finally becoming more responsive to what people in the community are saying. The Board of Health should end the government mandates and replace them with sound guidance that the public can trust. And that guidance can include masking, and people should be able to learn about what masks work and how they can protect themselves. But people should not be threatened with criminal punishment and mandated to wear them. That's just not what the public health department should be doing. I appreciate your hard work. You guys have a difficult job right now. Thank you.
Great. Thank you. I do not see a hand for Katie O'Block. Kate Ovia, if you are on, great, I see your hand. And if Ben Solberg can raise your hand, you are on deck. And Kate, your 3 minutes starts now.
Wonderful. Thank you so much. I appreciate it. So I first want to say thank you for letting me share my concerns. I was first going to talk about the metric for the mask mandate, but now based on what was said, I feel like I need to pivot and just address what the others have been and focus on the mandate for early learning centers. So I'm a mother of 2 kids. I have a 4-year-old in an early learning center here in Boulder. So I strongly have to push back on what was said earlier, that the staff in these centers are worried about lifting the mandate. That's just not true from my personal experience. All the educators that I know, both in K through 12, and specifically the folks at my son's preschool, are strongly opposed to the mask mandate. From personal experience, it's just crazy to me that anyone thinks a 2-year-old, 5-year-old can wear a mask effectively and that it's going to stop any kind of spread. My son's mask is disgusting when he's done with a day from school. And importantly, as the earlier speakers said, the science on mask and COVID among children, the studies that have been done are not at all supportive of the mandate for kids, regardless of what the CDC is currently saying. The US is one of the only countries recommending masking these young kids. And it's especially crazy when we know, based on the data, that children are among the least vulnerable to COVID. So why are we even considering maintaining the mask mandate specifically for this population? If we want to protect vulnerable populations, as we said, then we must be protecting our children and protecting their right for normal social interactions and give them the chance to develop normally. So as a society, we're going to be unraveling the long-term effects of this for years to come. So with this in mind, I just please implore the board to reconsider the mask mandates, especially for the young kids in the K through 12. Thank you so much for your time.
Perfect. Thank you. If Kathy Russell can raise your hand, you're on deck. And Ben, your 3 minutes starts now. Ben, are you there? Okay, Ben, we're not able to hear you.
Can you hear me now?
Yes, we can. Perfect.
Okay, sorry about that. All right, so I wanted to call in, like many of the others, to just ask. It looks like we're probably leaning towards rescinding the mask mandate, but the other issue, like has been brought up many times, is the kids in the early development learning, schools and things like that. So much of that early childhood development is picking up facial cues and facial expressions and reading lips to watch mouth movements and things like that. And they're having such a difficult time. My wife watches a 2-year-old every day. And while she's doing really well, her parents don't make her wear masks anywhere. But I see other kids that are, 3, 4, 5 years old even, that they're having such a difficult time with their speech because they've missed out on 2 years worth of learning. So we need to adjust what we're doing here. We need to just drop it. I mean, we've heard other people. The facts are the cloth masks and things that the kids are wearing and stuff in schools. Number one, 2 and 3 year olds are not wearing masks correctly anyway. Number two, they're causing more harm than they are helping anything. That age group has such a small chance of having significant illness at all from COVID that it's really, I don't even know why this is even a discussion that we're having. Every other county in the state has lifted or is lifting their mask mandates. I don't know why Boulder is always the last one to move on anything. But we need to rescind the mandates, and we need to not have special things in here for the younger kids. Their risk is so minute. We don't need to be worried about this. There's so many other things that we can be doing with our time and effort and money. So again, I'm asking, let's, not only rescind the mask mandate, but rescind it for everybody. If businesses and places want to have people wear masks, they can feel free to do that and feel the effects on their bottom line if they so choose. We've got to get these kids out of masks. I've got 4 kids in public schools, and it's such a hindrance to their learning. It's such a hindrance to their social.
Your time is up. Thank you.
Learning. And thank you.
Perfect. Thank you. Scott Papp, if you can raise your hand, you are up.
Excuse me. Kathy.
And Kathy, yes, your 3 minutes starts now. We just got to make sure Scott raises his hand.
Okay, thank you.
Go ahead, no problem.
Yeah, well, it's really great to hear everybody talking about ending these mask mandates. I'm in complete agreement, and I agree with everything that's been said. And I wanted to add the other really important thing, which is mental health. We are facing an epidemic in this country of deaths of despair. In Boulder County, not a single person under the age of 30 has died of COVID. Meanwhile, in 2020 alone, 130 Boulderites died deaths of despair. That includes suicide, drug, and alcohol overdoses. 16 people under the age of 30 have killed themselves. This is a disgrace. It breaks my heart. My nephew's best friend killed himself. It is just awful what is happening here. The other thing that's just so distressing is there's an epidemic that I just learned about. I've known about it. This THC, this concentrated THC that kids are taking, it has taken over. And why? Because it's despair. These kids they're masked up. They're just in massive distress. The stress everywhere. You go to the grocery store and nobody's making eye contact. People are freaked out. We have got to end this freak out. We've got to end the deaths of despair. We have to return to happiness and joy. We live in the most blessed world, and these mask mandates are a lie that are making it like we have something to worry about. The only thing that we have to fear is this fear itself. So please end these mask mandates. And again, another point, 97% of all the most vulnerable people who need to worry about vaccines or who need to worry about COVID, they are protected. People and the mask people said one masking works. Whoever is vulnerable, wear a good N95 mask, and that will protect them. And the cloth masks don't work with the transmission. So thank you for listening.
Great, thank you. I do not see Scott Pepp's hand, so Terry Gallagher, if you are on, can you please raise your hand? And then if Susan McReynolds, if you can raise your hand, you are on deck. Okay, great. I do not see Terry Gallagher, but I do see Susan McReynolds. Ryan Conrad, if you can raise your hand, you will be after Susan. And Susan, your 3 minutes starts now.
Hey, can you hear me?
Yes, we can.
Okay, great. Yeah, thank you. I guess first, I definitely agree with what everyone else has said. I think just first and foremost, to get it out there, you guys need to accept lifting the mandate for kids 5 and up, and you absolutely need to change the recommendation from the experts and lift the mask mandates from kids 5 and under in those childcare settings. That makes no sense. That's cruel, and it's on the verge of just being totally outrageous. I just want to say that the science has been clear. We need to stop masking our kids. Like many of you on this call, we all watched the Super Bowl last night. We could see an entire stadium full of 78,000 unmasked people, attendees and celebrities who were defying LA's indoor mask mandate. And why did they do this? Well, they did it because they didn't feel at risk from COVID. But kids, the least at-risk age group, still had to go to school masked today. So instead, our local bureaucrats, our politicians are intentionally not wanting to follow the science, and the COVID safety goalposts keep moving. In fact, I think everyone knows this, but the head of the teachers union recently stated that, the masks shouldn't be lifted until there's 0 transmissions in the school. I mean, does that statement even live in reality? The obvious answer is no, it doesn't. It's completely devoid of common sense, science, and the data. Last May, the CDC released a study that considered over 90,000 kids attending 169 schools K through 5th grade in Georgia. The study looked at several different mitigation measures like school mask mandates and compared the spread of COVID-19 between schools that had these measures versus schools that did not. The data showed that universal masking in schools didn't do much to reduce the spread of COVID-19 among students. And the Georgia schools that did require universal masking saw 2.4 cases of COVID-19 per 500 kids. Kids that did not require universal masking saw about 3.8 cases of COVID-19 per 500 kids. So why are our kids still being masked? Our children are not second-class citizens, but that is how they're being treated. Our children are not stupid. They are watching us, and they remember everything, as every parent can attest to on this call. If you think this generation is going to grow up and respect you, you are wrong. They know that masks are garbage. Parents know that too, and they go to school forced to participate in political theater for the last 2 years. Parents across this country have had enough. Haven't you had enough too? Or is this really about holding on to power and control? Will you be the county that agrees to recognize the science and move forward, or the county that's known as the one that resisted for as long as possible? Lift the school mask mandate for our children. The pandemic is over. It's time to let kids be kids again. Thank you.
Great, thank you. Amy Day, if you could raise your hand, you are on deck. And Ryan Conrad, your 3 minutes will start now.
Thank you so much. I'm speaking to you this evening as a parent and as an educator here in Boulder Valley School District. First and foremost, I just want to thank you all for your hard work and your leadership during the pandemic. As a teacher, I'm overjoyed and filled with hope to hear the recommendation of the Boulder County Public Health to remove the mask mandates in our K-12 schools. I'm really here this evening to talk to you about our kids. Our children have made incredible sacrifices during the pandemic and have endured significant loss, trauma, and disruptions, all to protect the greater good of our society. They're resilient, they're amazing, and they've done so much for us. I just want to express great gratitude for our kids. As an educator, I have seen firsthand the harmful effects of the pandemic-related restrictions have wrought on our young people. Kids are struggling and suffering, and they desperately need this return to normalcy. In our schools and classrooms, we are seeing an increased amount of kids struggling with mental health problems, behavioral challenges, and social isolation as they confront significant barriers to learning and community building as a result of prolonged masking. As a teacher who's been working with kids throughout the pandemic, I can tell you that universal masking does, impede communication. It hampers the development of social relations, hinders learning, and negatively impacts the emotional well-being of kids. Masking also has impaired my ability to teach. As a teacher, masking makes it more challenging to communicate, to connect with students, to assess what they're learning, their engagement, their emotional well-being, and social dynamics. I'm so just thrilled to hear the recommendations, and I just want to say, for the sake of our kids, their education, and social emotional well-being, please support the recommendations that have been made this evening to remove the mask mandates in our K-12 settings. Thank you so much for all that you do and for your time and consideration.
Great, thank you. I do not see Amy Day's hand. If Derek Harner and Chris Blues can raise their hands. You both are up next. And from there, it will be Christina Eisenstein and Heather Nichols. If you can go ahead and raise your hands as well. Okay, great. I do see Heather's hand. From there, we are going to have Erin McHugh, Ryan Scott, and Jessica Dieterheim. If you could all raise your hands as well, we'll start working through that list. And Heather, we will start with you, and Christina, you will be on deck. Heather, your 3 minutes starts now.
Can you hear me?
Yes, we can.
I'm really glad to hear what you guys are proposing for the most part tonight. I am also, and I second, so much of what's been said. I'm also a mom of an 8th grader and an 11th grader. I'm a social worker. I'm a psychotherapist, and I've lived in Boulder for 25 years. My 8th grader at the beginning of the pandemic basically started into such a mental health crisis and addictive spiral that he is now in a residential treatment facility in Utah in 8th grade. And this all started when the pandemic started and the lockdown started, presumably lockdowns to keep him safe from getting COVID. Well, he got COVID and he had a headache for a day. So these measures that have been taken, the masking, the toll that this has taken on our kids, the mental health strain that this has put on our children is so huge, so underestimated, and so under discussed and under addressed. And this will go on for decades. These kids will be affected by this for the rest of their lives. So please drop the mask mandates. It is time for all of us to return to normal. It is time for us to see each other smiling again. It is time for kids to see each other smiling again and to have normal lives, to have normal social interactions. COVID for healthy people is not a huge threat at this point. It definitely is not for the little children, especially. Please don't ask them to keep masking. It's ridiculous. It doesn't work. It's not effective. And those kids are going to suffer major mental health and developmental issues if you keep masking them. You know, exposure to COVID, I don't see it as a bad thing. I had COVID. My whole family had COVID. It wasn't a big deal. We have natural immunity now. Do you remember when they used to do chickenpox parties? What if we had COVID parties and we let kids get it? We let them get exposed to it and we let them develop the natural immunity that actually helps our whole community and strengthens their bodies and their immune systems. Boulder used to be this mecca of natural health. And I don't know what happened during this pandemic, but that just went goodbye. Let's return to normalcy and trust immune systems and trust children and let them have normal lives again. Please take away the mask mandates for everybody, including the little kids. Thank you.
Great, thank you. Christina, your 3 minutes will start now, and Derek, you are on deck.
Oh, okay. Can you hear me now?
We can.
Okay, great. First of all, I'm just delighted and encouraged and confident when I hear everybody speaking, because I agree with all the comments made by the public speakers tonight. I am incredibly relieved that the board is considering dropping mandates from K through 12. I also agree and support wholeheartedly that the mandate should be dropped for every child. I was having a conversation with a teacher just a couple days ago, an early childhood center teacher, and she said to me, you know, I would support the mask if they worked for little kids. She said she spends half her day swapping out masks, snotty masks of little kids. They sneeze in it and then she gets their snot on her, and she chuckled that now she has their bacteria and their germs from their sneezing. The kids sit in closed in spaces in a small room, in the same room they play in all day with their mask off for lunch, and they sit together in closed spaces. So I think, you know, at the beginning of the pandemic, we all buckled together. We did what was necessary. We followed the CDC. And now, just as an individual, I feel I have whiplash from the CDC. And it's time to get back to where things make sense. You know, if the masks were truly critical, then why can they take them off and eat side by side? It's just political theater. It's time to drop the mandates for everyone. As other speakers have said, the masks inhibit social emotional growth. They inhibit verbal development. And why should our kids have a disadvantage living in Boulder County, where we pay higher property taxes than other counties that have dropped the mandates for everyone? And I think just finally, you know, Governor Polis has been talking a lot about this, like there's no right answer. I support choice. Those who want to wear a mask, that's fine. Those who don't, that's fine. It's time to give the power back to the people and the parents. That's all.
Great. Thank you. Chris Blues, if you can raise your hand, you will be one of the folks on deck. Aaron McHugh, if you can raise your hand, you'll be on deck. And Ryan Scott, if you can raise your hand, you'll be on deck. Derek Harner, your 3 minutes starts now. Thank you.
I'm a student at Erie Elementary, and I was like when we have PE and stuff, we can we're having troubles breathing because the masks are making our we just can't breathe out of masks. And if we're gonna drop masks, why don't we drop them today instead of in 2 weeks? And on snow days, why did half of my other school district get a not online learning day, but we had to be online. But even though we only had to be online for 2 hours, we had another 3 to 4 hours of extra schoolwork. So it's like for a lot of stuff, like the person before who said at lunch we can eat right next to each other and stuff like that, but we can't have our masks off just in the classroom. And like just when we're just trying to like be able to breathe at PE and we're having troubles breathing because the masks are just like closing our lungs pretty much and like just making it really hard to breathe for us. So that's why I think we should drop masks.
Great, thank you. Amy Day, you'll be on deck. I see that you hopped on, and Ryan Scott, your 3 minutes starts now.
Hi, this is Ryan. I would, thanks for the moment to speak with everyone. I would just like to first say, I think ignoring your constituents in person is unfortunate, especially under the guise of COVID. Not meeting us face-to-face in person is very unfortunate via Zoom. Not answering incoming questions on your online forums and otherwise disabling comments is not a way to treat your constituents. I am completely against removing the mask mandate across the board, and I think that your vaccine verification program needs to be dropped immediately as it's discriminatory and serves no purpose. A new study from the University of California in Davis shows no significant difference in the viral load between vaccinated and unvaccinated people who tested positive for the Delta variant of SARS-CoV-2. It also found no significant difference in between the infected people with or without symptoms. This is completely arbitrary, and you choose to put this up in front of our community despite overwhelming pushes on the other side. Washington, D.C. is dropping their vaccine verification program effective tomorrow, and you should do the same. You've never tried to once state what the percentage risk of death is for kids under the age of 18. And here, I'll be very clear. It's 0.0002% for a death rate for kids, and that's even including significant comorbidities. Why are you parading vaccines with kids when they are hardly at risk of COVID in the first place? That's a shame. And I think it belies the ignorance that you're spewing out to the community. I find your vilification of the pandemic of the unvaccinated to be very misleading. You're misleading the public by including partially vaccinated people and calling them unvaccinated. And this is coming out in Colorado Health's official data. And that is, to me, lying. I think at the least misleading. Ignoring population-wide comparisons with highly vaccinated places and places that don't wear masks at all is just being ignorant to a fault. Look at Miami, Florida for a comparison on masks. Look to Israel for a comparison on vaccine efficacy. Humans have the same biology worldwide, and you choose to focus on your own internal studies rather than comparing population-wide data. It's time to drop all mandates. Cloth masks don't work. Asymptomatic testing isn't effective. Quit playing pandemic. Get back to promoting general good health. We're not sick until proven healthy. And stop this vaccine verification program immediately. It serves no purpose. And kids have been unnecessarily vilified during this whole process, which is just gross to watch. They aren't at risk. And you could not explain that away with numbers. And I think it's just terrible. The kids have suffered so much throughout this. Your vaccine verification program serves no purpose.
Your time is up. Thank you.
Great, thank you. If the following folks could raise your hand, you are going to be on deck. Jessica Dieter-Hum, Nancy Grignon, Chris Lysing, and Amy Day, your 3 minutes starts now.
Okay, thank you. Can you hear me?
We can.
Okay, thank you for this time to speak. I am so grateful for that boy who spoke 2 speakers ago
for telling everybody what life is like in school in masks. And I'm grateful for the speaker prior to me for how concise he was. I too am disgusted at the fact that you are all on Zoom still. I think it's an absolute embarrassment. I have been to New York City. I have been all through Florida. Everyone is laughing at Boulder. It is utterly ridiculous that these children are going into school masked at this point. I agree with the prior speaker. They are not a risk. There is not a single statistic in this godforsaken country right now that proves that children are at risk of getting or spreading COVID. The vaccines are a bigger risk for them. I think that we've had our 6th suicide at Fairview. That's number 6. Someone is accountable for that. I hold Boulder County accountable for that. These children cannot connect. These children are faceless. They are identityless. It is disgusting. It is time to stop. The study out of Brown University for children between the ages of 0 to 2 found that if they were born during the pandemic, they have lost 22% of their IQ. The follow-up study that was done 18 months later between children 0 to 5 years old found that they have lost 24% of their cognitive function. That is almost a quarter of their cognitive reasoning. That is disgusting. It is child abuse. It needs to stop. If people want to mask, please God, let them mask. I don't care. But to make it a mandate, especially for these children, it is inexcusable. There is nothing to support it, and it needs to end.
Great, thank you. I do not see Jessica, Nancy, or Chris with their hands raised. If the following folks could raise their hands: Allison Stronsky, Joshua Leisure, Fawn Von Pelt, James Schurer, Natalie Newland, David Jones. Okay, got a few of you here. Okay, great. Let's go ahead. Allison, your 3 minutes will start now, and Joshua, you'll be on deck.
Hello, I am requesting that you rescind all mask mandates. I think it's time that our Board of Health acknowledges all health rather than solely focus on COVID mitigation. We are 2 years into this and much has changed. Masks are no longer a momentary inconvenience. They are shaping the way our children develop, socialize, and learn. And I really want to emphasize that for the young children. I was a former early childhood educator, and I just cannot believe that we are even entertaining the idea of keeping these small children in masks any longer. I'm also currently a parent of a first grader who's learning to read right now. And just to see the way that these teachers are having to manage that is it's just devastating, because teaching children to read with your mask, with your face covered, it's just a joke. I have watched in absolute disbelief as our so-called public health experts continue to place such heavy burdens on our young children with such complete disregard for their long-term health. There's so much more to health than ever getting COVID. It is with complete devastation that I come to you with the data that our Board of Health chooses to ignore. Children's Hospital of Colorado has declared a state of emergency for youth mental health. They are stating that suicide is now the leading cause of death among children. They are seeing a 90% increase in demand for behavioral treatment. Placing our children in this heightened state of emergency for 2 years is having a huge impact. This cannot go on being ignored. Our children need and deserve normalcy. We can see now that doing things we claim are for their benefit have actually been at their expense. Please acknowledge that mask wearing for 2 years, upwards of 6 hours a day, is a behavior that we do not know the long-term risks and outcomes of. It is disingenuous to maintain an intervention to preserve health while simultaneously ignoring the health crisis we are creating by forcing our children into another year of emergency protocols within their schooling. I ask that you recognize that different children are prone to fall victim to different risks. Parents who feel their child has an increased risk for poor outcomes of COVID have the option to vaccinate their child and household, participate in online education, and/or continue with masking. What options are being given to the children who are facing mental health challenges that come from mask wearing all hours of the day? What about the children with special needs who are facing an increased hardship on their education as they struggle further to connect with peers, recognize facial expressions, speak and understand those that are speaking to them? There are many of us who feel continuing to force our children to subscribe to an emergency mindset is causing way more harm to the children than the mask could be providing in benefit. As a Board of Health, you have access to statistics and data for COVID deaths, hospitalizations, and infection rate. However, so do we. We have access to something you do not, though. We have access to our own family and children's health risks, as well as awareness of their mental health and emotional struggles. It's time to empower parents to make choices that are best for their children. We can best protect our children by trusting the people who know and love them most to make these decisions. Thank you for your time.
Great, thank you. Fawn, you will be on deck, and Joshua, your 3 minutes starts now. Joshua, are you there?
Hello, yes, can you hear me now?
Yes, we can, thank you.
Okay, perfect. I see why you guys don't want to meet in person. There's a lot of dissenting opinions today. I don't see much of the debate that has been mentioned in the presentation. But my name is Joshua. I'm a Boulder County resident. I'm here to speak on the mask mandate that's been in Boulder County for months now. Recently, the COVID-19 discussion has changed. 90 of 100 immunologists say that COVID will be endemic, meaning that it's here to stay and we need to learn to live with it like the flu. The CDC director has admitted that 75% of vaccinated individuals dying of COVID had 4 or more comorbidities. And Dr. Fauci says that there's a difference between those hospitalized with COVID versus for COVID. So hospitalization numbers are even inflated. The Johns Hopkins database continues to show that there's a 98.8% overall survival rate for this virus. And all of this shows that this is not something that we need this board or anyone else to address. Yet you have done so with mask mandates, which are both ineffective and devastating to our community. As previously mentioned, N95 masks, which are the best, filter particles to 300 nanometers, but the COVID virus is 60 to 140 nanometers wide. So even the best masks allow the virus to pass through a gap over twice the size. Due to the construction, CDC says that cloth masks are completely ineffective. So the mandate itself is providing little, if any, protection in all reality. Yet the effects of the mask mandate have been devastating to our youth by eliminating their connection to friends and to their carers. Brown University study that's been cited many times tonight has showed that there is a 21-point IQ drop in children up to 3 years of age, and stated that this significant of a drop is not seen outside of major cognitive disorders. Speech therapists have seen a 364% patient increase over the past 2 years. And Dr. Jean Nobel, the University of San Francisco COVID director, states that social phobia, isolation, all the way up to suicide attempts show that this is a crisis. The CDC data shows a 51% increase in suicide attempts of girls 12 to 17 and a 22.3% spike in 12 to 17-year-olds overall. So what should we do? We should be getting rid of masks and never considering them again. Other states and counties are doing so with the great joy of their residents, and cases continue to decline. We should let people gauge their own risk and make their own decisions. We should stop forcing our children and our businesses to carry the weight of this ineffective mandate. When the solution to a problem becomes more harmful than the problem itself, it's time to admit that we were wrong and remove the so-called solution so that it does not continue to devastate our community. I call on the members of this board to stop forcing us to treat our neighbors as disease degenerates everywhere we go, and let us again form the unmasked community science continues to show is necessary for human thriving. Thank you.
Your time is up. Thank you.
Perfect, thank you. Natalie, you will be on deck, and Fawn, your 3 minutes starts now.
Hi, can you hear me?
Yes, we can.
Okay. I am a Boulder County resident and a mother of 3, a 7-month-old, a 3-year-old, and a 5-year-old. And everybody else has talked about the statistics a lot, but I want to kind of give you my personal experience with my 3-year-old, especially of how masks has really been a detriment to him. in the sense that things that used to bring him joy to do, he no longer wants to do because he feels like he's constantly being hounded to wear his mask. And so I imagine this will affect him for the rest of his life, of just feeling like he is unable to live up to expectations that are put on him to keep a mask on his face when he doesn't have the maturity and physical ability to keep it on. And then on top of that, kids are not able to keep their masks clean like they should be. I've read study after study of how important that keeping masks clean and hygienic, and if they get dirty, to change them. But no one, like, these kids aren't able mentally, physically to do that. You have kids who are being potty trained and they're bringing their mask in while they're trying to use the bathroom in schools and other facilities, and it's hard enough to keep a kid from touching everything in a bathroom situation, but then trying to keep a mask clean in that, and then they're going to schools, and that's on teachers to do with how many kids in a preschool class, 15 maybe, and it's just not possible for the kids to keep their masks clean. I had my child accidentally throw his mask away in the trash, and as an adult, if we did that, we would get a new one, but he's afraid that he will get in trouble. And so he grabs the mask out of the trash and puts it on his face before a teacher can stop him. So, like, he's getting this feeling of being a bad person or not being able to live up to what he should be doing because it's hard for him to keep the mask on his face. And that's not even touching the speech problems that kids are suffering from and other issues that other people have talked about. The World Health Organization does not recommend kids 5 and under wear masks. So that's a huge organization that is obviously science-based, and we don't know the long-term consequences of masking these children, but we are seeing that it is negatively affecting them. And our family did have COVID, even though we've been in a mask mandate since August, I believe. And all of my kids got it.
Your time is up. Thank you.
Thank you very much. James, you will be on deck, and Natalie, your 3 minutes starts now.
Hi, can you hear me?
Yes, we can.
I'm the mother of a 2-year-old in Boulder County who's struggling under your mask mandates for childcare centers. To answer your question, Brooke, 2-year-olds cannot properly wear masks, and they are only wearing cotton masks due to suffocation concerns, and no, surrounding counties are not masking kids under 5. For a developing toddler, masks are a big deal. The World Health Organization has never recommended masking kids under 5 because they're at the highest risk for learning loss and language development issues. We've already heard how speech therapists referrals are skyrocketing from pediatricians and how younger children have suffered cognitive decline over the last 2 years. Speech literacy and cognitive issues will plague toddlers like mine for the rest of their lives, limiting their potential for future success. And for what? Our cases have followed the same trajectory as mask optional areas in our state and across the country during this Omicron surge. My 2-year-old son got COVID despite being in a mask mandated county. He recovered fully within 48 hours. Thankfully, our kids under 5 are at the lowest risk for severe outcomes from COVID, much lower than the risk of a vaccinated adult. Strapping a mask on and covering the face of my COVID recovered 2-year-old for 8 hours a day in daycare is unscientific and cruel. Toddlers his age are in the throes of building critical verbal and nonverbal communication skills, socio-emotional skills, and empathy, foundational things that they need to grow into complete and productive members of our society. They cannot do this properly with their faces covered. Seeing faces is the norm for pediatric development, so the burden of proof is on the intervention. And we have to be intellectually honest about the lack of credible data to support it. It's been nearly 2 years. We have the data and we were wrong. It's not appropriate to mandate an intervention when the benefits are unclear and the harms are non-zero. 2-year-olds cannot effectively wear masks or communicate if they're okay under a mask. If they're having a hard time breathing, God forbid they're having an emergency or choking on a toy, They use their facial expressions to communicate their needs. While adults may make do or be inconvenienced by masks, for toddlers, it's not a developmentally appropriate ask. It never has been, and it's not now. It's time to not let pride or politics dictate our decisions and let our youngest, least vulnerable to COVID, but most vulnerable to restrictions and changes in their environment, suffer because adults are unwilling to admit their mistakes. We need to repeal Public Health Order 2021-07, requiring masks on kids in childcare settings effective immediately. Your proposed amendment will decimate daycares in this county, and we will pull our kids and put them in other counties if it stands. Thank you.
Great, thank you. I'm going to read a list of names of folks whose turns are approaching. If you could go ahead and raise your hand. David Jones, Jane Meager, Charlie Wynn, Lori Sane, and Kathy Martin. Thank you very much. And James, your 3 minutes will start now. James, are you there? Okay, let's go ahead and skip to chart. Oh, are you there? Great.
Oh, I'm
James?
sorry. I didn't realize I was on mute.
Yeah, no sweat. Your 3 minutes starts now.
Well, let's see. I'll start over. So you guys have heard from children. You've heard from teachers. You've heard from doctors. You've heard from parents. Every single person who's made a comment tonight has spoken in favor of removing these mandates. The only issue that hasn't been discussed is the fact that you guys are going to continue to make unvaccinated people wear masks in indoor settings, if that's correct. This vaccine does not stop transmission. It does not stop infection. So, continuing to have any mandates surrounding COVID-19 vaccines or masks is really irrelevant at this point. And the only pandemic we have is the failure of our federal health agencies and our state health agencies. Honestly, you guys should all be ashamed of yourself if you choose to continue this nonsense. We've seen all the school districts around the country, but we've also seen countries like the UK removing these mandates, Netherlands, Denmark. It's happening all around the world. And if you guys want to be on the right side of history, I strongly recommend that you listen to every single comment that's been given here tonight. Thank you.
Great, thank you. Charlie, your 3 minutes will start now, and Rebecca, you will be on deck.
Thank you very much. I want to say how impressed I am with the voice of the people. I'm also very impressed with how educated and informed they are about this COVID. We need to get together as a loud voice and let you know what we think. First of all, there have always been pandemics. This is not the first one. We even knew exactly what was going to happen. An exercise by the federal government called the Crimson Contagion exercise showed exactly this scenario, and yet we were unprepared. As I look back on the last 2.5 years, I'm extremely impressed with two things. One, that we were able to develop a vaccine, an effective vaccine, in such a short period of time. I'm also impressed with when the coronavirus task force stood before the American people every evening for nearly 6 weeks. The president, vice president, and Drs. Fauci and Bricks stood unmasked and explained to us what we needed to do. And to say this, the American people did respond. What the American people didn't respond to were inconsistent, irrational mandates, closing of schools, lockdowns, double, triple masking. But most egregious to me as a physician was, in a time of a deadly pandemic, physicians were denied the ability to treat their patients early with safe treatments that were supported by clinical evidence. We now have an effective vaccine, but this is experimental. But it is able to protect our vulnerable population. And most of the vulnerable population, up to 98 to 99%, have taken the vaccine. But now some public health agencies are mandating vaccination for children. Why? SARS-CoV-2 has only a minuscule impact on our children and young people. The vaccine is experimental with increasing evidence that may show that it's deleterious has a deleterious effect on our children. In a recent study, JAMA noted a significant incidence of mild and pericarditis in young people. Inconsistent and irrational mandates have destroyed the trust in important public health institutions. There will be another pandemic. We need public health institutions that have credibility. Mandates are not the way. Instead, as the coronavirus task force did, stand before the people, explain the problem, and outline what needs to be done. Trust in their leaders is the best way to elicit compliance.
Great, thank you. I do not see David, Jane, Lori, or Kathy with their hands raised, so I'm going to read a few other names. If you could please raise your hand, your turn is approaching. Catherine Curvin, James Chestnut, Andrea Cox, and Brandon Fisher. And Rebecca, your 3 minutes will start now. Rebecca, are you there?
Hello?
Perfect. Okay, we can hear you.
Oh gosh, I've never done this before, so I'm a little bit confused.
Yeah,
Anyways, you know, I'm listening to all these comments, and I really didn't prepare a whole lot this evening. And you know, my husband really wanted to be here to speak tonight. He is an anesthesiologist at St. Anthony North, and we have been saying what these people are saying for the last 2 years. I mean, 10,000% in agreement. I mean, the man manages airways, and he just rolls his eyes up and says, "What are they doing to these kids? It's insane." And you know, a couple other things I just want to say. The kids from 2 to 5 and under, let them go maskless at this point. I mean, what are you trying to prove? These kids are going to be fine. I think keeping them masked literally broke my heart. I don't know about you, but when I was listening to the woman with the baby in the background, like literally tears came to my eyes. What more do you want? I let the littles just be unmasked and be themselves. It's over. It's truly over. And the other thing I want to say, and I was hoping that folks would actually say this as well, speak after me. What's up with the 25th? Like, it literally takes a second to take a mask off. What's signage? What is signage? Really? Just drop it. Be done with it. None of this, oh, we got to make preparations. We need signage. Come on. That is idiotic. And it actually, to me, it's kind of comical. So I don't know. I think y'all need to drop the signage and just move on and remove it as soon as possible for all children, no matter what age they are, particularly for the kids under 5. Honestly, they're the ones that need it the most. I don't have kids under 5, but I think it's disgusting. I think it's harmful. And if you keep that mandate for kids under 5, I can't even. The disdain. Anyways, that's all I have to say. Get rid of the mask mandate. We don't need signage. Move on. Thank you.
Great, thank you. I don't see Andrea or Brandon's hands raised. So James, you will be on deck. Oh, there you go. I do see Brandon now. James, you will be on deck, and Catherine, your 3 minutes will start now.
Yes, can you hear me? Can you hear me?
We can.
Yes, this is Catherine. I go by my middle name, Anya. I'm a registered nurse, and I have a baccalaureate and a master's in nursing as well as business administration. I've served my country in Vietnam in the Army Nurse Corps, as well as I've served people in Boulder for the last 30 years. And there's just a couple points I want to elaborate on, because I think there was a couple pieces of confusing information. So I'm just going to state those two pieces. In 2020, as we know, Dr. Fauci stated the masks have little to no efficacy against viral infections. Why? And as a couple of the speakers already stated, masks do not work against viruses because the viruses are too small. They are 10 times smaller than 1 micron. Masks are manufactured at the 1 micron size. The weave is too big. So no matter how well it's fitted, your mask, the virus will flow through the material. According to CDC data, 85% of the people in the US that contacted COVID-19 reported wearing a mask, and that's Gutag's study. Under congressional testimony on September 9th, 2021, Dr. Fauci conceded he could not cite no scientific justification for the policy. You all heard the harm it's doing to our children. We should be appalled. One other piece about viral spread, which seems to be confusing as well. Harvey Reich, MD, PhD virologist from the Yale School of Public Health, February 2022 study demonstrates that masks have not slowed the transmission of COVID-19 virus. The viruses, like influenza, cannot be controlled by masking the healthy population. Additionally, the pandemic is over. We are in endemic phase. There is no emergency order in place by our governor. There is no really scientific reason to continue this masking policies, particularly of our children that have, as everybody has stated, less than a 0.01 fatality rate. So I urge you all to really follow the science and stop with all this craziness that you put upon us. Thank you.
Great, thank you. Brandon, you will be on deck, and James, your 3 minutes starts now.
All right, can I be heard?
Yes, you can.
Perfect. All right, thank you so much for holding this meeting and letting us take the time to give some comments. My name is James Chestnut. I'm a resident of Boulder. I moved here just before the pandemic started, before the original outbreak. I moved here from Denver, and I am absolutely delighted to hear really the absolutely unanimous support of lifting these mandates and ending these public health orders. Those who have spoken before me have provided the data better than I ever could, but the science is clear that the masking is not working. The CDC has said themselves that masks are not effective, the cloth masks. And even as Catherine just said here, even the N95s, and as others have said too, the weaving for these masks does not, the viruses can still pass through. So there's really no scientific reason to continue the masking and have it as a mandate. As everybody said, if people want to wear masks, if that makes them feel more comfortable, it maybe helps slightly for some folks, but ultimately it's not helping the issue. And to hear what's happened to the kids and the anecdotes from the parents tonight, that's been the majority of comments, is how hard this is on kids and their development and their speech. It's clear that we can't continue having masking for kids. It is abuse of the children and their development. We have a baseline immunity now. Boulder County was one of the first areas of the country to have community spread of Omicron, as evidenced in our wastewater. And this happened after the mask mandate went into effect in fall last year. So that again is evidence that the masking is not working. The fact that somebody provided a figure that no one under 30 in Boulder County has died of COVID, And so you take all of that, knowing that we have immunity now in our community, and you think about the mental health impact that masking is having on kids, especially, but all of us as adults and our connection to each other in the community. It's just clearly time that these mandates need to end. And I'm glad that the director has recommended that we lift the mandates, and I stand in solidarity with everybody else who's spoken tonight that we need to end these mandates now. Don't wait, just end them as soon as possible. There's no reason to wait till the 25th for the kids. Let's end this. The time is here, the science backs it up, and it's what needs to be done. It is necessary. So thank you for your time. I appreciate you taking our comments.
Great, thank you. Jessica, you will be on deck, and Brandon, your 3 minutes will start now.
Am I on?
Yes, you are.
Okay, thanks. First, as a resident of Boulder, thank you for the opportunity to provide comment to the County Board of Health and Health Department. Like many this evening, my comment is regarding the mask mandates coming from the Health Department. Presuming that during tonight's session, there will be a vote that ends BOCO's mask order, including for my 5-year-old daughter when she's in our preschool, and finally aligns us with the rest of the world. So my comment is going to be in regards to the future. Bluntly, we need to make sure that our health department is never able to do something like this to the residents of Boulder County again. For those of us who have followed the science and the data of this pandemic obsessively, as I would hope that our health department is, it was clear before and throughout 2020 that the value of community masking provided was weak. When the vaccines became available, the value went from weak to negative. I was disappointed to see slides earlier tonight indicating that BOCO Health is going to continue to focus on cases and suppressing cases. Everyone here knows we're living with SARS-CoV-2 forever. At least I hope everyone knows that by now. And fundamentally, we know that once we are no longer immune naive to an evolving respiratory virus, either via vaccination or previous infection, the worst thing we can do is try to completely avoid all exposures to it. We need the exposures to the virus in order to build and then maintain strong, robust immunity to it. This is not a controversial take in the science of immunology and infectious disease. It's a fundamental understanding that we have had for decades before SARS-CoV-2 arrived, and it's why we don't fear the flu each winter, because we let our immune systems receive exposures to it, and our immune systems use that knowledge to build protection against it. Our amazing vaccines have provided us with the gift that makes it safe for us to move on with COVID like this. So going forward, we now understand that mask mandates don't have a measurable effect on spread anyway. But even if they did, it's not healthy to us as a population to shield ourselves from the virus. And certainly not the health department's job to order us to try to shield ourselves from the virus. So since there's no reason for us to ever do this again, I would like assurances from the board that you won't let it happen again. And using forced masking as an incentive for adoption of your vaccination verification program, like you've done, especially in a community with such a high vaccination rate, is frankly disgusting, and you should be ashamed for that. Lastly, I think it's also disgusting that you're proposing to continue forced masking of our population that is least vulnerable to COVID and most vulnerable to the developmental harms of masking. Based on the data, these poor kids, even unvaccinated—
Your time is up. Thank you.
Great, thank you. It looks like we lost Jessica, so I'm going to read a few more names. If you can please raise your hands. Travis Starling, Courtney Blanco, Jessa Ellenberg. Okay, and I do see Travis. So Courtney and Jessa, if you could, okay, great. I see Jessa as well. So Travis, your 3 minutes will start now, and Jessa, you will be on deck.
Hey, I'm having an issue. I cannot see the board members during this event.
Okay, they should be visible if they have their cameras turned on. Otherwise, they will turn their cameras on when they speak.
They should turn their cameras on during this because we need to see them as we talk to them, right?
Our cameras are on.
Okay, great. Sounds like the
Yeah,
cameras
you have to change your view.
They've been on the whole time.
Yeah, you have to change your view.
Perfect. All right. So Travis, your 3 minutes starts now.
Okay. Well, I got to say that a lot of the stuff that we've gone over here is pretty much spot on as well, so I won't take up too much time with that. I do want to address that it's clear from seeing about 60 minutes of presentations of numbers just to convince yourselves that you're on the right track. That's a little worrying. That's called confirmation bias, and it's been troublesome throughout the pandemic, and it's clear that it's an issue with this health department. I really encourage you to take a look into what confirmation bias is, how it manifests itself, and why you guys might have an issue with that. Because we've gotten a lot of information from a lot of people here, and it's pretty much the opposite of what you guys are presenting. I don't know who you've talked to, but that's certainly not the consensus we have here tonight as far as the mixed review goes. I also just want to touch on some other things. So, yeah, you guys need to be in person. This is ridiculous. Everyone went back to work last year, sorry. You guys need to get in person and get with the times. Hiding online on Zoom, that needs to end. Also, let's establish some facts. We have the same COVID here as we do anywhere else. Boulder County has had one of the longest, if not the longest, mandates of any county in Colorado. And our transmission rates are in line with any other county in the state, just about. Even counties that have had no mandates. Let's be absolutely clear. The current mandates from this board that we're discussing now have had no measurable impact on transmission in the community, not a bit. You cannot point to a drop in cases at a time when mandates went into effect. It does not exist. Unfortunately, this board is totally committed to making the data work for them and their confirmation bias. Anyone willing to look at the data knows the mandates haven't panned out, and that's okay. We tried something. It didn't work out. That's fine. This board should recognize that with some humility for the first time. When this unelected appointed board first enacted mandates, I followed along because it seemed like it made sense. There wasn't any data at the time. Things have changed. What I've witnessed from this board the last year is that when the science began to evolve around your mandates, you tensed up and doubled down. Science be damned, because this is Boulder, right? Frankly, this board's lost a significant amount of public trust from the community. Go look around the stores in this county and see how many people are following your mandates. Not as many as you think, certainly not 100%. As you proudly proclaim on your orders, your mandates are grounded in Colorado law with a $5,000 fine and a year and a half in jail. Year and a half. You've turned a serious provision of the law meant for public protection and safety into a mockery. Imagine the next public health crisis, anything remotely worse than COVID. The community's frustration with this board's failure to recognize the basic concept of morbidity versus case numbers means you're robbing us of our ability to respond to the next challenge. People won't listen. Clearly, this board cannot differentiate between public health and politics. It's becoming harder for us as well. The people of Boulder simply cannot tell where public health ends and political policy begins for this board. Please stop the politics.
Your time is up. Thank you.
Great, thank you. Courtney, you will be on deck, and Jessa, your 3 minutes starts now.
Can you hear me?
Yes, we can.
Okay. Thanks so much for this opportunity to speak. My name is Jessa Ellenberg. Greg, it's great to see you here. I'm a Boulder native. I have 2 elementary school kids at Uni Hill. I'm immensely relieved to hear the direction you are going with giving the parents and kids the choice to mask. Masking is particularly difficult for bilingual learning. I'm also relieved because I was prepared to move districts to one that doesn't have a mask mandate. I'm hopeful I will be able to stay in Boulder. I'm very disheartened in agreement with many of the other commenters to hear the thought that of upholding the mask mandate for 2 to 5-year-olds. And I agree with everything that has been said here tonight on that matter. My son would like to say a couple words as well.
My name is Sam, and I am 9 years old, and I really want masks to go away because It's really annoying because me and my friend, we were just sitting at our tables doing work, and then this teacher came in and told us we were going to go to the principal's office because we had our mask below our nose, and I really didn't like that. I just didn't want it to happen again, and I wanted masks to go away so she couldn't say that to us. I'm done.
Thank you so much for your time. That's all we have.
Great, thank you. Courtney, your 3 minutes will start now.
Thank you. Can you hear me?
We can.
Excellent. Thank you for the opportunity to speak. Thank you for this meeting and for taking public comment. It is heartening that you are relieving the mandate. It is interesting timing that it seems to be in coordination with other political leaning districts. As far as the timing goes, we will take the win. It's been a busy night for me. But I want to say, I thought that I heard leaving masks in place for 2 to 5 year olds. And that is bizarre if that is the case. It should be a choice for everybody, regardless of age. And the fact that it was mandated for 2-year-olds and 3-year-olds in the first place is beyond cruel. We are going to see the ramifications of that for a generation, and it's soul crushing to those kids. It is heartbreaking, but it is also hardening as a parent to realize that we have much more power at home and power as a collective. And I believe you are seeing that, the collective power of parents tonight. Thank you, parents, for speaking up. Thank you, Boulder parents, for coming together, for school districts to show that we care about our kids immensely, which is why we choose a good district like Boulder Valley and the schools in it for our kids. We have amazing teachers for the most part who truly care. But it's been really awful to see the power trip gone on, the power trip taken on by so many. We can only hope that this is leaving, this is going away. And I hope so many parents send their kids to school able to breathe freely starting tomorrow. Thank you.
Great, thank you. And it looks like we may have time for one more. Let me see. Do we have Tina Bermudez? Tina Bermudez, if you are on, can you raise your hand? Let's see in it.
Can you hear me?
Oh, perfect. Yes, Tina, your 3 minutes starts now.
Okay, great. Well, everybody's really, I can't believe I'm the last one to speak because everybody's pretty much said what I was going to say as well. I'm disheartened at the beginning of the meeting to see the data coming up, and I seriously questioned where some of that came from. For the last 2 years, I've tried to understand justifying keeping children masked. It was understandable when it began, but we're 2 years in now and we know so much more. I have to say thanks to the Johns Hopkins University that we've recently learned that the lockdowns and all the preventative measures we've done barely made an impact on reducing spread. I listened to a meeting last week with the Boulder County Public Health and Boulder County Chamber of Commerce, and I found it interesting that Lane Drager actually stated that according to the research from the CDC, I would have to question what research, because they have not confirmed that there is any benefit to masking anyone. There's been no peer-reviewed research focused on all of the different face coverings that children are wearing, and therefore there isn't any reliable data to show that they're effective. Actually, given the recent graphs of the COVID positive cases in Boulder County schools, with our kids now masked for almost 2 years, with almost a 92% somewhat vaccinated population, to see a spike in cases shows us that the masks are not effective at reducing the spread. So there's your data. If they were, there would not have been a spike at all. But I'm feeling like we're completely ignoring the fact that the spike happened in a time of year where illness spikes anyway. Furthermore, I don't understand why this board has completely ignored Children's Hospital's announcement that there's a state of emergency regarding the mental health of our children in Colorado. They have seen a surge like they've never seen a surge like this before. These kids are full of fear and anxiety, and I have to say shame on the adults that have permitted this to continue. When in our history have we ever put the responsibility on the kids to keep adults safe? That is absolutely absurd. I am a former early education teacher. I'm a teacher of the deaf, and I work in the healthcare area today. And I am absolutely appalled that there's even consideration to keep our youngest still masked. It is inhibiting their language development. It is inhibiting their academic growth. It is inhibiting their social emotional development. I agree with everybody. Why are you waiting to ease us into removing masks? End them now. You can do it in a day, just like you did putting them on them. We weren't eased into putting on masks. We didn't ease these kids into masking. We told them you had to have a mask. They were in a mask the next day. Get these masks off. There's absolutely no reason to keep them in masks until the 25th. I believe in parent choice. I believe parents know their children best. And I think that they need to be given the responsibility to make the best choices for their children. A mask need to remove.
Your time is up. Thank you.
Great, thank you. And that does bring us to 8:15 and the conclusion of the public comment portion on the COVID and mask related agenda items.
All right, thanks for managing that, Kate. And thanks to everybody who stayed on until 8:15 to provide those comments. Hopefully we didn't take you away from your Valentine's Day dinner. And so what we're gonna do now is we're gonna take a 5-minute break, give everyone a chance to get some water, do whatever they gotta do. And then we will come back and we will deliberate it as a board. Before we close this part of it though, I do want to acknowledge that we had probably about 250 written comments. And certainly while I looked at a significant share of them, it was, I would say the majority of the written comments were not in favor of mask mandates. Wasn't unanimous, clearly, but it was definitely more than 50-50. So thanks to everybody who took the time to speak. Thanks to everybody who took the time to write in. I know a lot of the board members looked at those comments as well. So thanks. All right. So
sorry, Greg, I'll jump in and add, we all read all of the comments. So if you were here tonight and you did not get a chance to speak and you've been waiting this whole time, please email in your comments. We do read them. We read every single comment that comes in. So please send them in. And I'm sorry, we ran out of time tonight for your comment.
okay, it's 8:17. We'll be back online, or I guess we can just, well, how do we do that? Just turn off our cameras and mute until 8:22?
Yeah, I think that's easiest.
All right. Okay, we'll see you back here in 5 minutes, everybody. Brooke and Landry, when you're back on, can you turn on your video so I know that you're ready? All right, looks like we got all the board members back. So let's see. Can we put the slide back up that had the recommendations?
Yes, just give me 1 minute.
No problem. Okay, thank you. I just wanted to put that up for now so board members and could just kind of continue to look over that. I suspect that there are questions that the board members have, before we talk about the deliberation process. I do have a question, a couple. And if we don't know, if it can just be like a kind of, yeah, we think that's right, we don't need the exact info. But when we implemented the mask mandate in September, that was a Monday night, and it went into effect on Friday, correct?
That is my recollection, President Thomas.
Okay, and that allowed, when you're standing up a mask mandate, obviously you do have to think about things like signage and all those kind of contingencies for your staff that might come about. And then do we remember how long, when we made the decision to drop the mask requirements last spring, how long of a lead time did we have to drop the requirement?
I will need to lean on Dr. Nolan or Ms. Ruland for that recollection, as I was not here at that time and didn't bring that information with me, sir.
I'm sorry, I don't have that information at my fingertips, but I'm happy to work on it while you all.
Okay, yeah, if you can, Lexi, that'd be great. And then for early childhood education, are most of the surrounding counties aligned with the K through 12 orders around masks?
Do you mean in terms of the age that they
In terms
require
of
them for?
right. So let's say from 2 to 5, or under 5, are the ECE mask requirements still in place beyond when the K through 12 mandates ended or end?
I believe that most of our surrounding counties had their mask requirements for 2 and over. There were maybe 1 or 2 that are 3 and older, and I believe they are sunsetting those along with their K through 12. I have not heard otherwise. Some counties have done under 11. I'm not aware of anyone doing under 5.
Okay, thank you. That's helpful. And then
Could I?
in an unmasked, so like last year, we dropped a mask requirement. And then unless you were unvaccinated. If we were to drop the mask requirement now, what would be the policy for those who are unvaccinated? Would it still be mask should be worn by those who are not vaccinated, even though there's really no way to ensure compliance with that?
Are you asking for requirements or for recommendations?
Well, it would be the same as last year, correct? I mean, that might not have been a requirement. It was just a recommendation, right?
I'll let Camille speak to recommendations, but I do want to point out that CDPHE still has an order in effect that does apply to all unvaccinated individuals age 11 and over. That's a state order, so not something that this board could change.
Okay, thank you for that reminder. That's it for my questions, Brooke.
You're muted, Brooke.
Could we discuss, deliberate over number 1 first and then vote and then move to number 2 and number 3? Because I think most of us will have some very specific issues with each one, and it's getting kind of mixed if we discuss all 3 at once. Oh, and now Greg, you're muted. Oh, Greg, I think you're muted.
All right, sorry about that. Yeah, I think that's a good suggestion, Brooke. Let's work through these one at a time, and then that way the questions don't get mixed up and jumbled. And then, so I guess I would say, let's talk about number 1. And I think the other thing we can talk about is the date and timeline as part of that, right? So if you have clarifying questions, that's fine. And maybe if you have alternate ideas, that would be fine to bring up in the space too. Go ahead, Brooke.
Yeah, so I think on number 1, I would be in favor of repealing. I don't believe that we need an additional health order to cover hospitals and medical facilities. I think that several of the speakers, including Dr. Mondro, had some good points, and that different offices have different levels of risk and different needs. So I believe that they should be making those on their own. I think my only issue with the 08 public health order is rescinding on February 18th. I wish it could be sooner, but I don't think that that is something that would stop me from wanting to vote yes and repeal this one.
That's 2. Okay. I'll tell you what, keep that thought. Let's get through the questions. And then I would probably ask you to refine. If you do have a amendment, then I would ask you to refine that, and then we'll come back to amendments for any of the board members, okay?
Sure.
All right. Go ahead, Morgan.
Sorry. Oh, I'll just echo Brooke's sentiment. I don't think that we should have a separate order for healthcare settings. And I would also be in favor of moving up the start date.
That's 3. Landry?
I agree. As a primary care physician working with a vulnerable community, I anticipate wearing a mask for at least 8 hours a day for the foreseeable future to protect the community. And I strongly do empathize with those who believe that continuing to wear a mask is something simple that we can keep doing to protect our community. But I think rescinding the public health order needs to happen based on the most available best science right now. And I also agree that there's no point in waiting. I don't think we need to wait 10 days to inform the community of our decision. I think we need to be open and willing to move our policies and not be sort of entrenched in dates or entrenched in one policy or another, representing these sort of other communities. It feels arbitrary to try to keep it with what other communities are doing.
Lindy? Thanks, Landry.
Yeah, I generally agree that everything that is being said right now. I am supportive of removal of the mandate for indoor masking. And I do agree that and I've thought about this a little bit, I think I agree with the recommendation not to add any additional requirements to the healthcare setting in light of this decision. I do think that particularly our systems will make those decisions on their own based on the input we're getting. I would like, in terms of the timeline, I know we're all eager potentially to move this particular policy forward. I also just want to recognize that there are a lot of people out there where this will be a shift and potentially make them uncomfortable. And we have not heard those voices tonight, but they are out there. And so I would propose that we do give it a few days so that businesses and individuals can get their minds wrapped around it, just as much as I appreciate the comments about potentially having the same timeline for all of these things to not create confusion. I also do think it's important that we allow a little bit of time and patience for people to get their heads around this prior to implementing.
Okay, thanks, Lindy. Morgan, did you have another comment?
Yeah, thanks, Lindy, for offering that, because I know and have heard from several people who are very worried about this, and I have empathy for those in the community who are vulnerable or live with somebody who is vulnerable. So I appreciate that. And one thought that I had is just, how can we support getting high quality masks to those folks who might be vulnerable and might have trouble accessing those. So I just don't know if that's something that our staff can assist on. I know there have been several articles out there about how to look for high quality masks or how to tell if they are fake ones that you're buying online. But I just, again, from an equity standpoint, how do we ensure that folks in our community have access to that information, and then to the masks themselves who want to continue to protect themselves and their vulnerable family members?
President Thomas, would you like me to respond? Is that okay at this time, or would you like to continue to deliberate?
I'm just not going to hit mute anymore. That's fine, Camille. I think it would help if it was in response to, the question as we get it.
Yes, sir. Thank you. Vice President McMillan, there are several programs out there right now that provide free medical grade masks to the community, and even at libraries, for example, they're being given away. And in many of our outreach moments to the community where we meet with municipal managers and law enforcement, we're always pushing out those messages, and then we do so as well on our website and can increase the communication post any decision you make to tailor it to that particular service that is out there right now. That's one of the positives that has occurred. In addition to treatments, there are more masks available. If I also may, while I have the floor, I did.
Sorry, Camille, before, I don't want to cut you off, just to ensure that those materials are also translated into other languages for our community residents. And then, again, I know that I've seen them being distributed, but I know that the Boulder Library ran out of their masks really quickly, and then they couldn't get more for a little while. So just mindful of that, the challenges, even if they are being distributed, how can we kind of keep up with that demand?
Yes, duly noted on the language and translation too. I know that much of our communication, if not all, is translated into Spanish and then when appropriate into other languages. So we would ensure that as well. If I may, did I answer your question now? I wanted to answer the other question that the membership had about the stand down of the previous order, the masking order, and the timing. And I did locate some information. It went into effect in mid-May of last year, and then was stood down on June 10th by announcement. So there was not sort of a segue or a time to stand down. There was an announcement that it stood down.
Great, thank you. Landry, you have another question?
I agree. I was going to say that I'm glad to to hear that that was the case, because that was sort of what I was recalling. And with regard to member Lindy, what you said, I think people can still absolutely wear masks, and businesses can still implement whatever masking requirements they wish. And based on the CDPHE, unvaccinated individuals should still wear masks. Obviously, that's not enforceable in any meaningful way. But I still think the people can broadly be masked if we rescind it tonight in real time.
Yeah, and thanks for that. And I appreciate the number 3, the advisory. I know we're going one by one, but part of my support of number 1 is that we do continue to offer advisories and support people in good public health practices, not only now, but in the future.
Camille.
Thank you. I wanted to clarify slightly. The masking order that I mentioned had a planned end date of June 10th of last year. And at that time, there was a decision not to renew. So I just wanted to have that small clarification for the board. Thank you.
Okay. All right, so it sounds like what we're hearing on number 1 is to rescind the public health order for public indoor masking, and also to rescind it for healthcare settings. Is that correct?
Do we have 2 separate orders in place right now, or is it just one?
I believe
Orders.
it's just one order.
It's just one.
And I would assume that if it went through as proposed, it would call that out, right? It would say it's rescinded for everything except these facilities, right?
No, it will still be rescinded for those facilities. They'll just have the option to do their own.
Correct.
Yeah.
But we could leave a public health order for masking in healthcare facilities. It just doesn't sound like that's where board members want to go. Let them develop because they're going to have their own policies, right? And so I don't think anybody's going to be surprised if they go to a health facility and see a requirement for masks, vaxxed or unvaxxed.
And President Thomas, just to be clear, if you rescind this public health order, any business or facility, not just healthcare facilities, could choose to implement their own
Yes,
mask
thank you.
requirements.
Thank you for that clarification, Trina. All right, okay. So I think just based on comments, that's where the board would like to go. So now what's left is implementation date. You know, we had, as Camille said, we had the intention with an end date. Last May, we approved extending it until June 10th or June, whenever it was. And then we just let it expire. So in essence, you know, people might have known a few days or maybe even a month in advance, but there was no like informational campaign, like you don't have to wear your mask in 72 hours, you know? So, so the question would be, okay, knowing that if we rescind it for healthcare settings, folks are going to need a little bit of time to just kind of create their notifications, signage, whatever it is, policy. So my thought is, I would say February 18th at 12:01 a.m. So, I mean, that is, we have President's Day weekend upcoming. Friday, February 18th is the start of that. Is that too far out? Is that too soon? How do folks feel about that proposal? Landry.
Are you just suggesting that to allow healthcare facilities to implement their own plans?
Yes.
Okay. Because I think you could phrase it in such a way that it's lifted immediately for other businesses, and then maybe until that date to give, so just so that to protect the ERs and other places where
okay,
patients might come in irate given that they've been told they don't have to wear masks, but then allow those facilities.
Okay. Understood. Trina, does that present any challenges?
No, I think it might look a little messy when we amend the order to reflect that, but it can certainly be done.
Okay. Lindy?
Yeah, I'm just not clear that we should rush to do this immediately. I think, and I know this is splitting hairs, so I will not fall on my sword, but I do think it's important that we give the public some time to understand that this decision's been made. So there's no confusion. Just as much as there was a comment made earlier about aligning the dates, which I want to talk about in a second in the next public health order, I do think that there's a need to let the public know, have it be known, and give them a few days to adjust to this new reality. That is my opinion, but I will not, again, I don't want to split hairs over the date.
I'm okay with leaving the date at the 18th if people feel that it will lower confusion. I think that leaving it at the 18th is acceptable. However, I would like to put out there, we have 744 people on this call. And if 744 people all call their friends and make announcements and say it was voted down tonight, probably will be a little bit tough to enforce between now and 4 days from now on the 18th. But if we would like to make that our official policy, and then also to agree with Lindy, if when we get to the next point, to align the dates potentially with the schools, the 18th would give more time for that.
Does it
Okay.
make sense then to discuss number 2 first?
Yes.
And then come back
let's
and
do
then
that.
vote?
Let's do that. Okay, so here's my thoughts on schools. St. Vrain Valley is out on Friday. They have a non-contact day, and then they have Monday off, the 21st. So with the date that's proposed, we're really talking about 4 days of in-school additional mask wearing while the general indoor requirement has dropped. Right. And at least in the K through 12, before Omicron hit, we had, we had numerous case investigations that said the exposure came from outside of the classroom. Not all, right, but numerous. And so those extra 4 days, what I was thinking is as of 12:01 a.m., February 22nd, because we do need time to notify parents, to notify the teachers. We know there's mixed feelings. I mean, we know what we heard in public comment, but there's also a whole crop of people out there who are nervous about this. And so there needs to be time to, really address that. Boulder Valley is in school on Friday, but they are not in school on Monday. So if you kept February 18th at 5 p.m. for both public indoor and schools, then there's no school on Saturday and Sunday, and school's done by 5. So in essence, you would be harmonizing those dates. That's a thought. Brooke.
Yeah, I think 2 weeks is too long to expect people to adhere to masking in schools if we vote today to rescind and if the universal masking mandate goes away on the 18th. So for K through 12, I would like to see them both done at the same time. It'll eliminate confusion. As many commenters mentioned, and I think it will also ease enforcement. And that still gives schools 5 days, 4 days, and then I guess the weekend if they want to discuss what policies they do want to have. And also for school boards to discuss if they want to implement any of their own policies. But I think having concurrent rescind dates is important between the two.
I think that's fair for the school piece. I think that makes sense.
And I think schools are going to be such an important communication partner in getting messaging out, both around what would still be advisory based on science, not on politics. We are a science-based public health board, despite what some accusations are saying. So I do think that it would help the school districts to get some communication together also for parents, and so that also there's not confusion about what's happening in the community versus what's happening in schools.
If it's helpful for the board, VVSD next school board meeting is February 22nd. SVVSD next meeting is February 23rd.
I was just gonna say, I also think it's important to still have a strongly worded statement discussing how masks are effective, that they've been used for over 100 years to prevent the spread of respiratory diseases, and that we still do support using masks and wearing masks. It's not rescinding the value of masks to say that it's not required for everyone.
And if I may, just to that point, it's the timing of your decisions and providing us the ability to tailor that public health advisory, which would strongly recommend masking and other activities, would be much appreciated. That's a consideration I'd like you to humbly take in as well. Thank you.
Brooke.
Do we want to vote on number 1 with that date in mind, or do we want to move on and discuss the rest of 2? So include the ECE portion.
Well, let's talk about the ECE first. My thoughts are, my son is not an ECE anymore, but I can imagine if he was, it is a difficult task to not only teach these kids, but also to keep their masks on. I think it's just based on what we know from what surrounds us. Boulder is not an island, and with no other requirements in place, I know those folks are not going to be eligible for vaccines, until probably the school year is over, at least, for any meaningful percentage of them to have it. And I just don't think that I'm on the opinion that we need to align. We can align with the school date, or we can extend it 1 more week, just in case they want to develop their own policies. But anyway, I can be swayed on that. Landry.
So I do have a 4-year-old, and these past years have been challenging. But I do agree with people who say, and children don't wear the masks very effectively. They already are not wearing them outside. They don't wear them while eating. They are much closer and in each other's faces, even with the masks on. And it's true that they are not the most vulnerable population. I think a strongly worded statement that would be sufficient to allow childcare centers to make their own policies would be appropriate. That would allow families to work with each center, come to an agreement, and make decisions about where to have their children based on how they feel about the mask policy would be appropriate. I think there is some very reasonable evidence that there's been a huge uptick in speech delay and referrals to speech centers. I think there is something there that's real. And it is true that the WHO has not advocated for wearing masks under age 5. And along with your statement, Greg, I think it's a little inconsistent with the surrounding communities to continue to require masks under age 5. I think it should be consistent with all of the children, all the schools.
Brooke.
Yeah, I agree with what Landry has said about aligning with the other groups as well. I do think the ECEs should also, the date should be, the rescind date should align with the other dates as well to eliminate confusion. You know, the bulk of the complaints that we have had since we put in this mask mandate have been about the 2+ mask requirement and the continual quarantines for daycares and other early childhood centers. And I don't think we can ignore that at all. Also, the assertion from staff that a lot of the ECE cases were coming from within the ECEs does suggest that the masks are not effective in that setting. They're either cloth masks, they're not being worn correctly, they're dirty, everything that was brought up by the public commenters. Also, we are definitely gambling on the impact of childhood development with this. You know, we've only had 2 years, so we don't have enough time to have done any great longitudinal studies yet. I mean, our longitudinal studies are all compared at a single point in time for a 2-year-old versus those in the past. And we are seeing things that are concerning. And so continuing to mask that 2 to 4-year-old population is a big gamble that we're taking. And I'm not willing to vote for that gamble again right now. And as Lindy mentioned, you know, it's not the most vulnerable population either. And ECEs are mostly private businesses. And so just like any other private business, they'll be able to determine their own policies around this after it is rescinded. So yeah, I'd like to see ECEs treated in the same way as the rest of the masking mandates.
I hear all that. I also have an under 5 kid. I've got a 3-year-old who's not yet able to be vaccinated. And, you know, I think, although I totally hear that it is not the highest risk population, there still are a lot of parents who are very concerned about having unvaccinated kids and the exposure. I have to say our daycare has done a really nice job of not having outbreaks, and they do have, you know, little miniature KN95 masks that seem to be doing a good job, but they may be more of the exception. And I worry a little bit about, it is not easy for parents to change daycare. It is really, really hard to change daycare and to do it quickly. And so if we rescind, and I'm not saying I'm against rescinding, I'm saying this is a really hard one for me. If we rescind the mask order and then the daycare, you know, daycares make their own decisions, then parents who decide that they are not comfortable with the individual daycare, they can't just find a new slot for their kids within 3 days. So that's my big concern around the ECE thing. And again, I hear all of the public comments about the concerns about masking young kids, and I hear that. And so anyway, that's my struggle, though. I think it's just important to remember that it is, if we leave it up to parents, it is very hard to change daycares on a dime. It's almost impossible to change daycare on a dime. So I think that needs to be part of the conversation.
I hear that, Morgan. You know, I mean, I think it's important to point out that in mid-January, the 0 to 11 group was the 4th highest in the number of positive cases, right? And so, anytime anybody's test positive, they're generally, well, that's not good, right? Because you never know what's going to happen. And so it's not that, yes, I get hospitalizations are perhaps much lower percentage once you have a positive test, and certainly deaths are even lower than that. But it's still a concern, right? And getting COVID is just not something that people are excited about. Lindy.
Yeah, Director Rodriguez, can you just remind me the rationale for the recommendation from the staff on this? I just want to make sure I firmly understand why you delineated the under fives. I think I know, I just want to confirm.
The biggest rationale for this recommendation was the accessibility of this group to vaccinations. And therefore, that was one of the reasons for the recommended slowdown. In addition, alignment with our Head Start partners who have a federal mask mandate that they must comply with. If I've forgotten anything else, Dr. Nolan or Trina, please do jump in.
That's correct.
Is our Chief Medical Officer, Dr. Haas, still on?
Yes, I'm still here.
Hi, Dr. Haas. Yeah, just wondering if you could, if anything that you've heard us discussing regarding either number 1 or 2, if there's anything you wanted to, add to that.
For number 1, I don't think I have anything else to add. I think, what little I was able to hear from the healthcare providers I contacted, I think just what has been said also in public comment, that I think healthcare settings will develop their own guidance and are comfortable doing that. And then for number 2, also, I don't know that I have anything more to add in terms of what other folks have said. Just in terms of, separating out ECE and the under 5s versus the K through 12. Admittedly, I'm not a pediatrician, and I hear all the concerns about development. I think that evidence is certainly evolving. Prior evidence hadn't really supported that, and the study that a lot of the public comment folks had mentioned also isn't peer reviewed. So I always sort of give that disclaimer that I think, all studies should go through a peer review process. I know we often do accept studies that haven't done that, but that's just something to keep in mind.
Thank you.
Sure.
Okay, well, then I think we've talked about 2 of the 3, so I think it's okay to walk through them in order, probably leaving the most additional deliberation for number 2B or the ECE under 5. So we have the proposal in number 1 to rescind PHO 2021-08 public indoor masking. That recommendation did, it says we could maintain the masking requirement in healthcare settings. I think we've deliberated on that. I think we're in agreement. And so how this works is that when we vote, we need a majority. We do not need a unanimous decision. So if we have 3 board members voting in favor, then that motion carries. We talked about February 18th, giving a few days lead time, 5 p.m. That will generally get you through the workday and the school day. So it'd be possible to harmonize that date and time. So if there is a motion to accept that under number 1, then please, would somebody make that motion?
I move to rescind Public Health Order 2021-08 on public indoor masking as of February 18th at 5 p.m.
A second.
Okay, we have a motion and a second. Any final questions? Okay, hearing none, can I get a vote? All in favor?
Aye.
Aye. That's 5 ayes. And so that motion carries unanimously. Now on to number 2, amend the Public Health Order 2021-07 on masking in K through 12 and 5+ settings. The proposal that was discussed was aligning February 18th at 5 p.m. for that masking and quarantine isolation guidelines to expire. Did I get that right?
I just want to
Well,
clarify because the proposal was February 25th. Are you saying align it now
Oh,
with
sorry.
February 18th?
Sorry, yes. So the recommendation was for February 25th. The discussion amongst the board was harmonizing those dates to create less confusion. We talked about the upcoming holiday and a non-contact day at St. Vrain anyway. So really through the 25th, you would be talking about 7 or 8 days of school, depending on which district you're in. I think the board members had indicated that aligning those two would create less confusion. We heard that in public comment, and we've experienced it before. So I think if I got that right, board, then can somebody make a motion regarding the K through 12 and 5+ settings?
Oh, so I have a quick point. Yeah, so are we then going to move that the K through 12 and the ECEs would both be rescinded as of February 18th?
I think we still have additional discussion on under 5.
Because they're together, they're in the same public health order. So we would have to split them and vote on one and then discuss the other, or we would have to agree on what we want to vote on now.
All right, is anybody in favor of splitting those and having different dates, or would you rather see alignment on all of these? I mean, I'll be honest. I mean, early childhood, I get the comments, right? I get the comments for taking the mask off. I get the comments for concerned parents. And yes, while they can still send their child to daycare with a mask, it's just going to be very inconsistent application at the facility itself during the day. And so it's probably not going to work very well. But, we'd have to see how facilities might implement their own requirements. So, I do think that, what is proposed is certainly to extend it through at least the next board meeting. And I have not heard support for that from the board members. So please correct me if that's incorrect. Landry.
I feel for the parents too. And I totally agree with Morgan that it's really hard to change daycares. I guess I'd just reiterate that I don't think children wear them that effectively, and children the under 5 crowd hasn't truly been shown to be disseminating this throughout the community. It's mostly coming from the community and the childcare centers have quarantined kids, which they may still need to do if a child tests positive, to have a child stay home. But on the playground outside, they're already not wearing masks and they're right up in each other's faces. They're not wearing masks while they're eating. I think it's only causing problems as opposed to really preventing the spread of disease.
Thanks for that perspective, Brooke.
Yeah, I completely agree with what Landry just said. I think what we're hearing is that masking is not so effective in the ECE setting. But I totally get what Morgan's saying too. It is very hard to change daycares, not even just on a dime, but within 3, 4, 5 months. However, we are putting the power into the hands of the ECE, and they always have the prerogative to say, we will continue the masking, or we will continue to mask in the same policy that we have been for the next few weeks while we make a decision on what to do. So we are just giving the power back to them as a private entity. So I would like to see the order stay intact with just both dates changed to February 18th.
So February 18th for both K through 12 and under 5. Okay.
Yep.
All right. Well, then can somebody make a motion?
I think Morgan's hands up.
Oh,
sorry.
sorry. Yeah, thanks. I just want to go on the record one more time and say that this is really hard. It is really hard. And I, we hear from people all across the spectrum on these, and we care about all of you, and we care about our community, and we care about keeping, in particular, the most vulnerable in our community safe. So I want to emphasize that one more time, that just to state out loud, these are really hard things to debate and to consider all of the cases and the voices out there. So that's it. I had nothing substantive to add other than that. Thanks.
Thank you for adding that. Lindy.
Yeah, sorry. I want to back up this whole conversation because this is a hard decision. And I think we're particularly struggling with the EC decision for reasons that I think are very self-evident. And I appreciate the dialogue. And I think that from my vantage point, it seems that we need to sort of align the policy across the board at this stage. There's not enough evidence to suggest that holding back the under 5s makes sense from a masking perspective, given all of the dialogue that has happened this evening. But it does not mitigate the fact that this is a very hard decision with consequences for parents and for kids. So thanks for all this dialogue. I think it's really critical.
Yep. And, also, I just want to acknowledge the staff who are the experts in this area. I know that they have conversations all the time. I'm sure the facilities are of, different opinions, just like the general public's of different opinions. And it's tough. I mean, this goes against that recommendation. And at the same time, I do think that that people do understand the confusion that abounds when you have different dates on different orders. And so, based on all of those things, I would be willing to support harmonizing dates for all settings.
Yeah, I think it will just further confusion especially for the younger set. When in this month, if we don't consider ECE until the next board meeting, if the little under 5 population has to wear masks and no one else is, the only potential problem I do see is the Head Start. So I wonder if anyone has insight into when that will be considered, the Head Start policy at the federal level.
We don't know.
Okay. Because I do feel for those communities having different rules than the rest of the community, but on the flip side, having children have different rules than their older siblings and their parents is also really confusing.
Yeah, thanks for that, Landry. And I also do think it's important to remind folks that you are still going to be required to wear a mask in places like public transportation, airports, airplanes. So the county order is not going to supersede any federal order that's still in place. Okay, well, we have, seems like we have consensus on number 2. So can I have somebody articulate a motion?
I move to amend Public Health Order 2021-07 on masking in schools, ECE, and youth programs with a rescind date of February 18th to coincide with the rescinding of the public indoor masking mandate for both K through 12 and ECE settings.
Somebody, we have a motion. Do we have a second?
I have a second.
Okay, we have a motion and a second. Any further deliberation? Okay, seeing none, all in favor? Aye.
Aye.
Okay, that's 5 ayes. That motion carries unanimously as well. February 18th at 5 p.m., folks. That is when the public health orders, county public health orders will expire.
If I may jump in, President Thomas, I know that I think you had alluded to also needing to perhaps vote on number 3 on this slide, and to limit confusion and to acknowledge the amazing discussions and public comment in the length of this evening. We do not have to vote on number 3. It was simply for your understanding that we would issue an advisory with strong recommendations and strong language for the community to lean on and support those actions oriented to continuing to prevent community spread. So you do not need to vote on number 3. I just wanted to have that clarity for you. Thank you.
Well, if we did, you would have my vote. So Morgan, what do you got?
Yeah, before we lose like the hundreds of people who are listening in to this meeting tonight, I also just want to encourage all of the people who organized around masks. I think it's great that everyone is engaging in public health this year. I think public health is really important, and we want people engaged in public health. And I'm so glad that people are engaging in public health. But before you all leave over the mask thing, I would love to see some of that engagement and organizing continue on topics such as air quality in Colorado, which really affect all of our children so deeply in their long-term health, and other climate-related measures that need organizing. And so if our community can organize in this kind of way around masks, I hope that we can continue to do that with some energy around climate and air quality in Colorado in particular. So please don't leave us in the public health world now that the mask order has been rescinded. Thank you.
Well,
Lindy.
sorry, and just I wanted to comment on the advisory. I just wanted to, for the record, state that the advisory was actually very critical to my decision on both number 1 and number 2 in our votes. So I just want to make sure that's very clear. I do think there are people in our community that feel vulnerable, and we support them in all the right ways from a public health perspective. And this is not mitigating the need to take care and pay attention to this advisory, particularly in high transmission times. So I just wanted to underscore that point for myself and for the public.
Thank you. Brooke, did you have anything else?
I think my only concern around the advisory is I just want to make sure that it is not misconstrued as a public health order. And so I would prefer, just to throw in my 2 cents, I would prefer if the advisory stayed more high level and still captured what Lindy mentioned, where we do emphasize the efficacy of especially KN95 and N95 masks, and encourage the use of masks during substantial and high transmission. However, I would not be, I don't think it needs to include the specifics on the former orders around schools or ECEs and even around public health facilities. I think it's better to just refer to the CDC guidance as a guidepost for that. Otherwise, it runs the risk of looking too much like a public health order, which is not what we're going for.
Okay, Landry.
I hear that. I do want to make sure that statement is strongly worded, though. I agree with Lindy on that, and also leaving the door open, to another surge. Things can change, and I think we should just always be willing to move with the times. It may happen again that we have to wear masks. That's entirely possible.
Right. Yeah, and that's an important point. That did come up, and we've seen this, at least four different times now. No matter how much we want COVID-19 to go away, it doesn't necessarily adhere to our desires. And so I heard, we can't ever do this again. It's like, hey, we might be back down that road. Hopefully we won't. Hopefully Omicron was the last wave. Now, regarding the public health orders that were in effect since September, if you remember, we put those public health orders in place due to the increasing caseload from the Delta variant. We had no knowledge of the Omicron variant, and you saw what happened from mid-December to the end of January. And so to say that, it's not important. I mean, that was something that came and went during this order. And sure, a lot of people unfortunately got infected, and combined with the high vaccination rates in Boulder County, sure, we have good community immunity right now. But let's cross our fingers and hope for the best. But there's no guarantee that we're done with COVID-19.
Yeah, and just part of, not necessarily putting the previous public health orders, though, into the advisory is to acknowledge that things do change. And so based on Colorado public health and CDC guidance, there's a good chance that if there is a future public health order on masking, it could be very different than what we have right now. Again, so just it leaves us open to be more flexible, and it doesn't look like an order.
All right. Well, thank you everybody for your time. We still have agenda items to proceed through, but for all the members of the public that provided comment, thank you. Thank you to all those who wrote in as well. Certainly unprecedented public comment period for this board meeting. So kudos to everyone. Okay, so going back to our agenda, and this should be fairly quick. We do have the deferred item 3, which was the child tax credit announcement.
Thank you to staff for staying on through all of that agenda item to discuss this really important